open. So every fever episode gets summarized.
Yeah.
So
So
that particular documentation is not coming out of this CRM.
yeah, I do understand. And Neeraj, is it possible to add another form in the fever loop?
I think Abhishek, there's no need to add another form. Only fever
Actually, yeah, Dr. Girish, the challenge, what happens with Somarth is once we fill that form, it will close up. So we cannot close all the forms if we keep it along with any other form. That is the challenge. नहीं जैसे ना फॉर एग्जांपल कि फीवर पर्सन इज ऑनगोइंग फीवर अब द डे इट एंडेड वी आर नॉट कैप्चरिंग दैट हाँ डेट लेनी है कि किसमें दे मतलब दे वांटेड कि अलग से इसको कैप्चर करा जाए एंड ऑफ फीवर हाँ मैं वही कह रहा हूँ कि हम दो क्वेश्चंस का एक फॉर्म ऐड कर देंगे कि फीवर हैज एंडेड ऑन दिस डेट द पेशेंट मतलब वो रजिस्ट्रेशन टाइप ही होगा कि द पेशेंट रिपोर्टेड दैट फीवर हैज एंडेड एंड इट वाज एंडेड ऑन दिस डेट और दैट्स ऑल चलो लेट्स वर्क इट आउट कि कैसे होता है नहीं देखो एंड डेट से कोई मतलब नहीं है हमारे फॉलोअप पे कोई फर्क नहीं पड़ेगा द पॉइंट इज कि इफ द पेशेंट रिपोर्ट्स ही इज afebrile देन आल्सो वी आर गोइंग टू टेक द कन्वॉल्यूसेंट फेस सैंपल तो उस पे तो कोई इम्पैक्ट ही नहीं आना है और वीकली फॉलोअप भी कंटिन्यूअसली चलेगा तो उस पे भी कोई इम्पैक्ट नहीं आना है ओनली थिंग कि वी जस्ट वांटेड टू कैप्चर द एंड डेट तो वी कैन कैप्चर दैट
Dr. Abhishek, one more thing that actually yesterday also we have suggested, like for any fever episode which is reported, can we have a telephonic follow up because these visits are spaced, right? Like 5 day 5 and then later is day 10 plus or minus 2, then 21 days. So in between there's a lot of time where the participant can get admitted, can get some other tests done.
That can be done at the site level but we are not having any unscheduled forms like that for to capture all those information and if you get any information so you can enter those information as a self reporting information. For example, if someone says he is suffering from fever from the weekly home visit and you are following it up and you are doing the every second day a call to that participant and if on second call or after 4 days the participant says that he is hospitalized so you can do the hospital registration stating it's a self-reporting registration.
So how can you call it self-reporting? It can't be self-reporting, right? It
So
is an active sort of surveillance which we are doing because it's we are calling them up daily for better.
But adding such kind of form, I think it is not in the scope of Somarth what Neeraj was telling
Even
me.
we, as per like our process, we have not built a daily visit for the fever cases. It's up to site whether they follow. They are visiting every day. If you come to know with the hospitalization, you can just register it. Okay, so we will not have unnecessary data because.
A log
Okay.
should suffice, I guess, like a telephonic log or something, a paper-based log, just for entering the data in it instead of having an electronic thing.
maybe you can have your own source for that, but what from that we should be able to summarize that particular fever event.
Yeah, that's
The
what.
summarization
That
is very important,
summarization.
but that will go only in EDC or in ECRF.
Yeah.
But that could be a source for you at your level, I think. That
Because
is a
as you're
site
adding
practice.
one end date for fever, this end date, if you go again in the convalescent phase and ask him when did the fever end, it might not be a correct date, or because if you have a daily follow-up sort of thing, like the end date and the real-time data can easily be obtained.
Even like in some scenario, in some places, we cannot be totally dependent upon the participant or the patient. We have to test whether the fever is end or not. You have to take the temperature. maybe it is that scenario will be not at CMC level, but maybe in Palwal we have that scenario. They don't know how to measure the temperature or something. Okay, so we have to go and take the temperature. So it's depend about site to site how they can go.
Okay, so let's convene after 15 minutes. Yeah.
During the last phase, in the recording part, we have interpreted one extra question. That participant had fever last visit, that means previous week visit,
Yeah.
and then after automatically come up with the last day one of fever, and we have asked. So when we visited last week, you said you had fever.
Yeah.
Whether that means continue today also? No, you can let go.
Yeah.
It will echo. Because the speaker, right? Right. Loud enough. So that we can add one more question. Whether that fever subsides today, last day continues. Certainly no problem. It is subsides when was subsides are completed. Then automatically the fever day will be captured. So that
Okay. Yeah. For 7-day follow-up visits we can incorporate. that.
Even now,
Yeah.
like the previous, we have our web-based telecalling system, and totally was automated. So we also face a lot of challenges due to that. Okay, so now I make it open. Whenever you come to know the fever, you simple go and register it. Okay, if in the call, if they have fever in between, you go and register into the fever reporting means tab and just report it. I will show it on the EDC. So that's yeah.
Yeah, but we can do that now. Like as
I
you are
think we
saying,
have
that we can
we
add
are
one or
asking
two
na.
questions, so that can be added in the weekly follow-up column.
I think in our CRM
As
we
far
are
as suggesting that we will add one question, did the participant had fever in the during the last visit? If it says no, so it will go as it is. But if it says yes, so has the fever resolved or not? If it is resolved, so just enter the end date. If it is not resolved, so then again it will keep on
anyway,
going.
like if we come to know, like we are going to ask the question whether you have fever from last contact. Okay.
Yeah.
If there is any fever, we have immediately go to the fever registration reporting form and we have to enter it. Whether it will resolve or
These
not.
are the separate questions we can add. 2 or 3 questions in that form only, so we don't need a separate form.
No, we need to have in fever reporting also. Fever reporting need to be done.
Fever reporting will be done on the new cases. Na?
No, for the old cases also. If you come to know after 1 month also, okay, after 1 month we come to know that there was any fever episode, then we have to go and report it on the fever reporting tab. Means all.
Okay.
Now, how?
नहीं, new भी old भी सब करने हैं.
No,
अगर miss हो गए,
No,
in
Mr.
case you have
Neeraj.
missed something.
no, Mr.
Nahin.
Neeraj, how will the field worker come to know about the last fever episode?
नहीं, like
If
for
it
the
is
last,
not popping up, or if it is not asking, giving any.
suppose there may be some scenario, for example, the participant has gone out of the town or something,
Yes.
and he came after 1 month or 2 months.
Hmm.
Okay, he was in somewhere. Okay, and when he came, when the research officer asked whether you have any fever during the home visit.
That is fine. Actually, it means it is after the last week. Means last visit.
contact, last
yeah,
contact.
last physical visit. Let us say.
Yeah, but
If that participant has any particular participant had a fever event,
hmm,
fever episode during that particular visit, and he goes out. Means he goes out of station or something, not
Yeah.
reachable, could not be contacted
that's
for any reason.
yeah.
And he comes back, let us say after 3 weeks.
Mhm.
Will the system SOMART pops up any question related to the previous fever episode?
It will not pop up.
No, if that is not popping up, then how will the field worker know that he had fever, and how will he be able to ask that question? Because physical recording will not be possible actually at the field level.
Physical recording will be not a, for example, suppose the participant is out. We have also the log.
Hmm.
Participant log, we have maintained the participant log in which we have the tracking of all 52 weeks. Okay, fever, we have a log for all the participants. And when last visit was done, on which week, that is going to be recorded. And once he will be appear, when the participant, like our research team will go and see that person, he will have the idea how many weeks they have missed out. So
That
that
is fine. No, I understand that, but
Yeah.
that is a physical work. We are just suggesting to automate that means popping up. That is possible.
it's not possible.
No,
For the
if it is
automation.
not possible, then the whole purpose of doing the cohort study is lost. That's my suggestion. That's my comment also. That might look crude, but this is based on our previous experience in many other studies. We struggled a lot in finding the end date of that fever, and
For the end date of the fever, like then we will have a one form. Okay. Until unless it is completed, it will not like the form is completed.
Yes.
The subject will not move to
okay,
the completed part.
Sir,
let-
sir,
no,
sir,
I,
we will
I
figure it
think
out. Yeah.
no, I think let us go through that form once. Then
Yeah.
we will means.
So that will the
See.
cases which will have any pending form, it will be in pending list. Okay, so you have to complete them. Like you have to fill the form, then it will go into the complete section.
Okay. Yeah, online participants, we will be taking the break of tea for 10 minutes and shall join back. Just to move forward. Next is the end line assessment. So in the end line, as it was also shared yesterday, that if a participant is having fever on end line visit, either he is already under AFI surveillance or he has been diagnosed on the day of end line assessment, then the end line assessment shall be delayed for that participant, and first we will conduct the AFI surveillance for that. Just needed one final consensus. Like on day 21, we will be taking the sample of that participant during the convalescent phase. We will be taking the sample for serology, dengue and chikungunya serology. And also, we are taking the same sample in the end line assessment for dengue and chikungunya serology. So, should we go for two samples or one sample will suffice? And we can label it as an end line sample, means like that is open, but I think one sample should work because we are doing the same test. Either we can label it as a convalescent sample or we can label it as an end line sample. That only we can decide. I will just stop and look for your comments. Sir from NIT, if you can suggest something. Sir, can I repeat the question? The point is ki during the end line, if a person is still under AFI surveillance, so during convalescent phase we have to do the serology testing, and also as part of end line assessment we need to do the serology testing. So should we take two different samples for the same test or one sample will suffice? And second thing, if we take one sample, so what label should we put? Should we put it as an end line sample or should we put it as a convalescent sample? So these are the two questions which we had. SAS team. Sir, if you can just.
I think one sample is fine.
Yes, sir.
Same sample will be an end sample.
Yes, sir. Sir, but my concern was we are having more number of tests under convalescent sample. Um, yes, sir. Yes, sir. Sir.
We should consider that as a convalescent sample. I
Yes,
agree
sir.
with you because IgM is there. But as far as taking data for the end line results, because tests are same, so
Yes,
we
sir.
can pick data from that. And
Yes, sir.
I think these will be very few cases, and we can deal with that on a case-to-case basis.
Yes, sir.
Yeah.
So, sir, the results can be replicated in both the forms.
Yes, because tests are same.
Yeah.
It's chikungunya and dengue IgG for the end line,
Yeah.
and in convalescent it is additional IgM.
Okay. Any other comments from KEM team?
And N-line would have the
Yeah.
dengue IgG also. Dengue IgG also would be there in the N-line.
Yeah.
That will be add-on test then.
The IgG we are doing on the convalescent also.
So
So that's why now, because we are getting the same results from the convalescent as we are looking for the end line. So instead of doing two different samples, we will do the same. But as sir has suggested that we can replicate the result. The result we get, we will put it in the end line also to close that end line form as well.
No, no.
yeah, because point of care yeah, it's there in the N-line.
The point of care can be means like can be clubbed with that, and we can put it in the end line sample. Basically, the point is both the visits can be done on the same day, so that we don't have to repeat the sample for the same person for a similar type of tests.
What's a gap between acceptable gap to be considered as the same visit?
Which
See.
one?
What
Uh,
would be like a
Ma'am, here the point is like at 365 days, the end line assessment form will open up. But if you go for end line assessment and if you find some person is already under AFI surveillance or he has been diagnosed on that day as a fever case, so then we have to conduct the AFI surveillance for that person, because we cannot leave that person at that point. We will just complete his AFI surveillance. So after 21 days, the last convalescent sample, we will also say it is an end line visit and we can conclude the study.
Yeah.
Yeah.
that should be okay, I suppose.
Sir,
Yeah.
I have one questions. Like for in case like we went, the baseline has been done, but then after that, if we couldn't find like the individual doesn't have a fever in all the follow up, but suddenly in the 365 days, like he reported that he had a fever, and that too through a passive reporting, like it's telephonic,
So
and that person is out of station.
yeah. So Jocelyn, that will go as a missed case. So that we have, as we have told you under the fever registration, that if any missed case is found, so we will go and register that as a fever registration case, and we will screen fail that person, but we will record all that information so that fever cases will not be missed.
Okay, sir.
Why? So we are having a window of 30 days. So if we can capture that participant in 30 days, so that's fine. We can have the end line sample. If not, then we have to miss. Because at one point we have to close the study. So that is the main point. So that's all from these slides for the field level assessments. And after that, we do have the CRFs for lab, but they are bit incomplete because there is no clarity on lab yet. But the lab CRFs are also in place, but we are not having the hard copies. But that we can discuss. I will just see how we can manage that. The lab CRFs. Or should I scroll them on the screen? Will that work?
We can try. Let's see.
Yeah, we can just scroll it on the screen if possible. वो lab CRFs इनको दे देते हैं. अरे वो इनको बेस मतलब उसमें दे देते ना पेन ड्राइव. Just give me a few minutes. I will just study.
Abhishek, Dr. Abhishek, as we have separated all lab CRFs from field CRFs, so this data entry will happen by the lab person, right?
Sir, the existing CRFs will be done by the field team. So these all CRFs are at the field level because these all activities will be done by the field team.
Correct.
The site lab, the CRFs which they will use, we are just sharing that
Okay,
for different tests.
And these CRFs are web based?
These will be Android based.
Android
So
based.
they will
That
be on the
means-
tablet.
So that means even lab people need a tablet.
Yeah, lab people will get the tablet for the next lab-based CRFs.
Okay.
Yeah, but these are field-based, na. So one tablet will be given to each cluster.
Correct.
One tablet
Correct.
for each
Correct.
cluster,
Correct.
and these all activities are field-based. So they will
Correct.
be doing all that activities.
Right.
Once the sample reaches to the site lab,
Correct.
the following CRFs they will fill or they will
In the
add
tab only.
in the tab only. That is also Android-based, na.
Hello. Yeah. So basically, what happened? Like we are not sure about the lab processes. Okay. So their
I
decision
mean,
need to be made.
that's not a good answer.
Let me clear it. That because there is two ways. They can be a one centralized lab. Otherwise, they can be a local labs. Okay. So if there will be a local lab, means each site like they can choose at their local level. Okay. So if that is a scenario, then I will build a Android-based application in which
So
site-
who will have this clarity? I'm just curious.
I think it's from the SAG members. So
Sorry?
from the BIREC SAG technical group.
I think we'll
Okay.
have it soon.
Yeah.
So we have that in place, but you are not aware. This is what you meant to say?
No, it's not in place.
It is
It's
not
not
in
in
place. So
place.
Not
basically, what we
finally.
are talking about for the lab-based data entry, okay, there are three places the data is getting generated. One is in the field, okay, lab, right? Second, data generation is in the lab who is processing the samples, right? And the third data generation is in the central lab where rest of the tests are happening. Actually, there is a fourth lab also, but let's talk about it later on. Like PRNT will happen into another lab that is common
That
for
is central
everyone.
labs. Yeah. These
Okay.
are the centralized labs.
So now we need to differentiate which data will be fed in by which place. I mean,
Okay.
we are clear about field.
Yeah.
We are clear about the lab, the local lab, right?
No, like the lab process, let me clear. The first thing in the field level. Field level, we are only collecting the samples. Okay. At field levels, the research officer who will go to the participant, they will collect the sample and they will hand over to the site lab. Okay, site the lab which is on site. Okay, for the processing. Okay, at the field level, sample will be collected and it will be scanned and everything. Barcode will be scanned and what time it was collected or something. So it will be detail will be captured in the EDC and uploaded on the server. Okay, once the samples reach the local means site lab, then it will go under the process. From there, it is totally manual process. Okay, if in case if we were thinking that they can be a centralized lab or they can be a local labs. Okay, so site can choose their own lab and they can get the sample for testing to their own labs. Okay, local labs. So for that, I have an option. I can build the forms, forms on tablets, and that can be entered through the site labs team. They can enter into the tablets.
So I think just to add to what Neeraj is saying, collection would always be in the field. That will remain unchanged, whatever its
Yeah.
lab is. The sample will come to the site lab, processing will happen there, aliquot preparation will happen there, just the way it is meant to be. Only the dispatch location will change depending upon the test. Methodologies and kits will remain the same.
No, even if we go for the local labs, okay, if the decision is that site will decide their own labs, then the report will come to the site lab only
Right.
at the site. So
And they'll
from the
enter
report,
from
they
the
can
data
enter it
manager,
into
they'll
the
enter the
yeah
report
enter
to the
into the
EDC
EDC
platform.
platform. It is centralized, and we like done the same process like as
Right.
it was for the COVID study. Then we can have that approach. Okay, so that's a
The only step different in this one is that in the earlier one, we had been scanning the aliquots also, but here we'll maintain a manual record of the aliquots in
Yeah.
the site level
So
only.
it's up to like decision, whatever decision come from the
Sure.
technical team. Then also in the tab also we can scan also.
Okay.
We will have the aliquoting form also there, the sample received and what happened, how many aliquots were created. So it will be scanned.
If that can be
Yeah.
done, it will be great because
On
then
EDC.
we get everyday report, like, if one sample is collected, whether we
Yeah,
could
yeah.
prepare all the samples or
So
there was a
that's what
Q&A.
we have two plans.
Sure.
Which plan will be processed? I'm not sure. Okay.
Ideally,
So-
the earlier one that you're already doing is quite comfortable.
Yeah.
Half of the sites are already trained.
So that's yeah, basically. Okay.
हाँ ये मैं इसको थोड़ा zoom कर दूँ.
So even for the local lab process now, if it is decided there will be a local lab for each site, so then hardly we will come with that app within a week time. So
We-
that's really not a problem. Okay.
Sure, thank you.
So to just to move forward with the lab CRFs. So here we are means like in majority we are looking at the data in logs. So that logs are available with us and we shall distribute it. So Neera sir, is it possible to distribute the logs? अशफाक आप लोग हेल्प अबुल उनको भी बोल दो हेल्प कराने में
जब जरूरत है तभी चाहिए।
I think it has been distributed. निशत कम पड़ रहे हैं? I hope every table is having one log sheet, or they can just share with the neighboring one. But that's fine. But we will be keeping the track of all the samples through these logs. Like there is one log which is on the sample, uh, which states that when the sample has been received, the date and time, and it has to be signed by the person who is receiving it when that sample is being processed, and followed by the number of aliquots formed and final signature of the investigator. So that is the sample log, and we will develop this according to the different stages. Like there will be 6 to 7 such logs will be there. One will be for the baseline plain vial sample which will be received. The second one will be plain vial samples received for the acute phase, follow-up phase, convalescent phase, and end-line phase. And also one log will be there for the EDTA sample. So like that, we will have 6 to 7 logs for different samples received at the laboratory. So that will be maintained in the paper. It will not be developed on the EDC. So we will share the soft copies also, but the hard copies, just for the reference for today, it has been shared. Apart from that, once we have received and processed the sample and aliquots has been developed, which will be developed as it was discussed yesterday. So we will be moving forward towards the EDC entries. So the CRFs which we shall be using for the EDC entry is shown on the screen. As we can see, this is for the baseline, the CRF 14A and dengue chikungunya ELISA results. So even I will request the lab persons from the each site, and also Dr. Minakshi and other persons to look at these forms, and we can modify the reporting format for the lab. But this is as per our knowledge and understanding from the previous studies and other things. We have just tried to enter this. Yeah. So, Dr. Minakshi, one my question prior to you will ask, should we go for the quantitative numbers also, or should we report only the qualitative way, the ELISA results? Because this is about the dengue and chikungunya ELISA at the baseline.
I think in the last one we have captured the title, but we have concluded with the interpretation, positive or negative.
Yeah.
But the titers is also there. I don't know what would you
Yeah,
need
but
for that
means like,
statistical
will
forms, you know?
that be useful,
For the disease,
or it
no.
is just for the, because otherwise sites are also maintaining the hard copies at the site, so that will be there. But do we need only the qualitative information, or we want to have the titers also?
No, titers also, no, because we
Titers
are going
also.
for the
So we-
statistical
also we need.
analysis later
Otherwise,
on.
Yeah.
we cannot find
Yeah.
the fourfold other things. No.
Yeah, we have
Yeah.
maintained the titers. That's how you'll go for the look at.
Okay, so
For the
uh,
scrub and all, you may not, because that's only IgM. So there it is positive, negative should be okay. Scrub and lepto.
so
And in titer value, it should be exact quantitative. It should not be more than 400
Right.
or less than
yeah,
300.
exactly, sir.
Yeah, that should be.
That should
maintained.
be
I
there.
don't know because so
Yeah.
it
So,
should be
So,
exact number.
that
Yeah,
was
Abul, I request if you can just mention it for CRF 14A. We need to mention the titer values.
the way we have it in
Yeah.
RFP2.
But apart
same
from
way.
that, means of the format will be fine if we
Excuse
enter the
me.
titer values. Yeah.
Yeah, for ELISAs, we don't have actually titers. What the kits we are using are actually qualitative ELISAs. We can give only positive or negative.
Yeah, but since in this study we will try to have a uniform thing, and it's better that we should have the quantitative numbers also. So I think
No,
the
no, there
titers
there
should
is
be
nothing
there.
called as
Yeah.
titers in ELISA.
We
We
would-
will have OD values, we will have the values calculated based on the cutoff. We will say whether it is positive or negative.
So we would be
It will be
discussing in the
yes, it is
meeting.
a qualitative ELISA. If you are going to use a quantitative kit, then you will get some values.
So
What we
Dr.
are-
Meenakshi, we are using the quantitative kits
Yeah, we
only.
are using the meant for the purpose only in the current study also.
Okay, if it is
We'll-
a quantitative ELISA kit, then the values, that is not titers, the values can be noted. But if it is qualitative ELISA, we can say only it is positive or negative.
So we have a session. I'm just putting a message. We
yes.
can meet in the evening for half
Because
an hour.
why
And
I'm
then
saying
share
is
the kits
the-
that have been
yeah,
identified. for
same
this study.
sample, if you run it again on the next day, the values will be different because the run conditions will be different. That's why I'm saying.
That's okay. That's intra-run variation would
Yeah.
be there, acceptable for ELISA. It's like 20%. So we would not be running anyways the repeat unless there's a situation like a batch failure or something. So in an ideal situation, it will be like
yeah.
within the same batch, it will be qualified.
Yeah, not repeating. I'm saying because there will be variations.
No,
There
that's
is no
okay.
point in
Yeah.
recording.
Right.
Yeah.
So we can, we'll
I think
update in the
I
evening.
think for all lab purpose, it needs to be very clear the type of kits and the results these kits are going to give out, because it will raise many questions at this moment if we try to see this. It's not only about giving positive, negative, but we are also having endpoints that is based on fourfold raise in titers. Maybe we are not sure about IgM IgG ratio at this moment, like what criteria we are going to use. But unless we look at the kits
Yeah.
that are going to be used to measure these antibodies quantitatively, it will be difficult to say anything at this moment.
So
Assuming that they are going to be quantitative tests, assuming all these kits would have been validated, then for all practical purpose, we should have a column or a space for the mentioning titer whenever there is a positive. If it is a positive, what is the value? Now, there is a terminology issue, whether we call it as a value or whether we call it as a titer. Unless we look at the kits, it's difficult to comment at this moment.
Yeah.
get some time, we can project those two, one sheet that we had compiled towards the evening. That
Yeah.
one sheet where we had the experts have given their suggested kits.
Yeah, sure. That we can discuss
We can
towards the
maybe,
end of this.
I was thinking to circulate, but they can project and then probably take opinion because I think
Yeah, that can be done after lunch.
sure. Only one that is
Yeah.
one
Both
or
the
two.
reagents and other
Yeah,
things.
there are two.
We can
One is
project
the
and take
reagent and
the
essential
commodity.
consumable,
Yeah.
and the second is the kits that have been identified with the catalog number.
Yeah.
So, you can take
So
opinion.
just to complete this current process, if you go back to the previous CRF,
Previous one. First one.
so we have these results. Like when you are mentioning the results, dengue, IgG, ELISA, when you say positive, if it is a positive, there should be a place to add the values.
Yeah.
Okay.
So we can put it as a bar, like what are the possible values from the lab, which states that titer above this will be called as a positive.
no,
below
you will
that.
no for calculation purpose.
Yeah.
But you will require exact value
Yeah,
that has been reported from the lab.
yeah.
It's not greater
No,
than or
the,
less than.
the site will enter the exact numbers. This is just for the reference to call it as a positive or negative.
No, the thing is, what I'm telling you, the way it is reported, once you, for whatever criteria, once you say it is positive, it will have some value.
Yeah.
So that value needs to be entered there also.
So,
Am I
Dr.
clear?
Abhishek,
No.
I am just getting it like we will enter the exact value of the titers and also the conclusion of that. So both the things will be there in the
So
CRF.
okay.
Yeah.
Huh?
And similarly for the chikungunya and similarly for the dengue. And that will help us to derive the final results.
Dr. Abhishek, I think the dengue IgG zero survey R1 and R2 would be the almost the same format that already we are doing it in Excel format, validated Excel and all.
Okay.
Because there the data would be used for different purposes.
Okay.
Whatever needs to go to the patient or participant will have to be like a report template. So I have a draft of that also we can see that can be
If,
maintained.
if it can be projected, so we can just go
Yeah.
through that. Yeah.
Because for your all other purposes,
Are
you need to
we
maintain.
talking about zero surveillance, isn't it?
Which
We are
one?
talking about zero surveillance, right?
Zero surveillance.
So no report is going to the patient.
No.
There is no report going to the patient.
Yeah.
Acute phase, it will
No,
go to
we
the
are-
patient.
Yeah, we are
mix-
just entering.
we are
acute phase.
mixing
This is
couple of
only about the
things.
baseline
Right.
survey.
So this is zero surveillance,
Yeah,
right?
zero surveillance,
Let me be very clear. Zero surveillance when we are going to report dengue IgG, chikungunya IgG,
Yeah.
there is going to be a value. Okay.
Yeah.
And these values will also have a qualitative outcome, whether it based on the values, whether it is regarded as a negative or regarded
Yeah.
as a positive.
Yeah.
Okay. For calculation purpose, because we are going to derive incidence out of it, correct? Prevalence and incidence.
Okay.
So for that purpose, we will require exact values. So that clarity is not there in the current CRM.
Now, how will we derive the incidence? Because this will only tell us about the prevalence of IgG antibodies, but we cannot derive the incidence from
See,
this.
we are doing at two time points.
We are doing it at two different time points. So at the baseline and at the end line, we are having two different values of the
Correct,
titers, maybe.
Correct.
And similarly, we are having the two different, maybe these antibodies
Correct,
disappear at
correct,
the end of the study.
correct.
It might be possible.
So in the second
Yeah.
zero surveillance study,
Yeah.
you will also try to identify the zero conversion.
Yeah.
Am I correct?
Yeah.
So during a period of 1 year,
Zero conversion.
0 month, 12 month,
Yeah.
if you find a zero
Zero
conversion,
conversion rates. Yeah.
what we will call it as?
Zero conversion. Or zero incidence. You can say incidence. Yeah.
Incidence.
Okay.
So that means for
Huh.
all practical purposes, we will have to enter the value.
Yeah.
And this is not a report that is going to the patients.
Definitely.
So this particular CRF needs to have a provision to enter the value for dengue IgG and chikungunya IgG.
Yeah.
Then whether it is a positive, negative, equivocal, that will be the second thing.
Yeah.
Yeah.
I totally agree. I will just enter two things: the titers of dengue IgG and chikungunya IgG into that. Yeah. Next one. तो अगर आप प्रोजेक्ट करा देते हैं तो that will work. Honey, even I didn't got that format, so that's why I have to prepare the formats. So the second thing is about the PRNT results. Though maybe the columns we can modify as per the last phase study. But again, in the PRNT also, I have the similar question: ki should we go for the titers of neutralizing antibodies, or does the PRNT provide us that titers? Because yesterday me and Neeraj were looking, we were not having any PRNT results from the last study, or might be we might be missing that. Yeah.
Dr. Manishi? Dr. Minakshi.
Central labs only. So
Ha.
they already have a report format and accredited test and all. So they, I think
Yeah,
it will come from there.
but
Same way that
in
is
the
there in
EDC
the-
we need to have capture
It's
those.
there in the already in the RFP too. So maybe Neeraj can help in those formats and the values. Right, Neeraj? It will be similar, same in anyways. It's yeah. Yeah, it's the same way. So I think the formats we can develop in the same basis, but manually rather than taking it from the portal.
Okay, so what is the suggestion? Should I go with the further formats, or should we look at the driven one formats, or if anyone can modify that?
So the way parent is reported by the testing laboratory,
Yeah,
that format we need to look at,
yeah.
and the similar fields needs to be there in the CRF if it has to be transcribed.
Yeah, actually, for others, so I have seen, because some formats has been shared to us from Dr. Minakshi, but so the others are fine, because only thing is I haven't entered the tighter thing, so that can be entered. But for the PRNT results, I haven't seen any format, so that
It is there. So like
yeah.
we have a meeting with TSTI and ISA, and
THST,
based on that we have prepared this format for the RFA2, and same format we are going to use in this
Okay.
study also. So it's already finalized. So we can keep, I think, all side no. Yeah. Yeah, it's 90 titles. Well, no, I think it's in ISA only. I think TSTI
Yes, sir.
don't have.
It
Yeah.
will be done in Irsha. See, technically speaking, here, although measurement is quantitative for PRNT, but the result is qualitative. Okay. So, documenting the titers, there is no harm, but it will not provide any additional information.
Yeah.
Because the purpose of doing PRNT is to identify the serotypes.
Serotypes and neutralizing
Right. And the
antibodies.
serotypes identification will be yes or no,
Yeah.
positive and negative. So one can have titers here. The previous case was different. Here, titers, even if you don't mention, that's okay. But it's good to have it.
So, should I move with other CRFs, or there is no need? Should I discuss? I will just run through all the CRFs quickly, and if means like we need to modify based on the previous one. So I think Dr. Minakshi, if you can just take that lead on developing those CRFs, could be helpful. Yeah.
I think we've already done that half part of the thing. So let's continue whatever we have
Yeah,
already.
only a few sections has to be deleted or added
Sure,
in these, so we can do that. That is not a problem.
we'll do that. Thank you.
Yeah. So the other thing is about the chikungunya PRNT results. Next. This will be the CRF 15 will be about the acute phase samples. So we will be looking at the dengue ELISA, which includes NS1 results, IgM and IgG results. So that will be the part of this dengue ELISA results. Uh, This is about the qPCR. So just to repeat what we have discussed yesterday, if NS1 ELISA is positive, then only we will go for qPCR. So here that's why I have added even the NS1 ELISA results also in this CRF, just to keep the things on track, that qPCR should be done only for the NS1 positive patients. There should not be confusion in the teams. Next. This is regarding the PRNT in acute phase. So in this, the two conditions are there. One is the participant should be NS1 negative, and second thing should be IgM positive. So if the participant is IgM positive, then only we will go for PRNT. And that's why the initial two columns are for NS1 and IgM, and later on we have just placed the results of PRNT, where we are again targeting to identify the serotypes. Next. This is about the chikungunya ELISA. So, based on yesterday's discussion, previously we were planning to conduct the chikungunya testing uh, at the convalescent phase. Though we are capturing the sample at acute phase, but both the samples will be processed together in the convalescent phase. But now, since we are targeting to include all chikungunya cases, irrespective of their seropositivity, so just needed a, a suggestion. Should we go for chikungunya testing in the acute phase itself, or should we wait or keep that sample for the convalescent phase to be again to be tested? So needed the suggestions. Dr. Meenakshi, you want to add something?
You're keeping the sample from the acute phase and club it with the convalescent, right? The paired testing. What is the question exactly? We're keeping only
No,
one
actually, the
adequate
point is ki we need to do a pair testing for
Right.
chikungunya. Now we are collecting two samples, one at the acute phase and another one at the convalescent phase.
Right.
Previously, we were thinking that the pair testing should take place together at the convalescent phase, and acute phase sample should not be processed at that point of time during the acute phase.
Right.
Now, my question is
Because
ki
it'll
if
chikungunya
if
anyways
we
will not appear by that time.
yeah
Dr. More, if you
yeah
correct me.
because the
wrong.
result of acute phase is of no use.
No, it will not
Because
appear.
IgG and IgM antibodies both will be absent as per the
Right.
serology of chikungunya.
Right.
So that is my concern. Ki if we don't get a convalescent phase sample, so
Mhm.
the acute phase sample is of no use. If we, even if we process it,
Right. It will
so
only be
should we go for pair testing in the convalescent phase with both the samples together, or we should go for the acute phase sample testing and followed by the convalescent phase sample testing?
I think I would say that as per my understanding, Dr. More can correct me and other lab experts also. I think IgM though would not appear in the from the acute phase sample anyways. So whether we are going to yield information, we're not too sure. But convalescent sample, keeping sample is not a problem that like we discussed yesterday, based on the stability and the volume, etc. Um,
It will add additional alicot, because as we were discussing ki agar if we are doing the chikungunya testing at the acute phase itself, so the sample can be clubbed with the dengue ELISA samples, so that impact will be there. Means like we will be forming 4 aliquots if it is clubbed with the dengue, and if it is not clubbed with dengue we will have 5 aliquots.
and the
Uh,
second part is whether we need to mobilize that sample only to the lab if it's not alicot.
That is not a problem because every site is having -20 or -80. So that is not going to be a major problem. But the point is ki should we make 4 aliquots or 5 aliquots, and when to process that sample for chikungunya?
at acute phase, doing chikungunya, either of IgG or IgM has no value.
No, sir.
Um, and our aim by doing this test is to capture the repeat infections, the way it is being discussed since
Sir,
yesterday.
repeat and also the new
Whatever the
infections.
newer infections.
Yeah.
So whatever may be the case, so we should go for that testing only in convalescent phase.
Only in
Yes,
convalescent.
there is a possibility if we lose a convalescent sample, we may not be able to capture it, but I think we will have to live with that.
Okay.
I think we discussed
Uh,
yesterday, and
yeah.
the only possible
And-
earliest would have been RT-PCR, but cost complaint, issues and all are there. So
Yeah.
alone, like Dr.
No,
More
PCR
said,
though
it's
is
no point.
not
IgM
practically
at
feasible.
acute phase would not yield any
Yeah,
value.
because PCR is costing thrice the
So
price what we are
only
planning
paired
for now.
testing would be able to give some
Yeah.
information. Otherwise, if there's no paired testing, it's not going to give.
Yeah. Any other suggestion from other teams? CMC, KEM, even RMRC is there. Any suggestions? Okay. So, what should I conclude that we are going to process the chikungunya sample only in the convalescent phase?
So the only one concern it may be if we get an inadequate sample,
Yeah.
then preparing 5 aliquots may be challenging. So that could be the case.
Yeah, and also means like it gives an opportunity ki we can reduce the sample amount of blood. Like presently we are taking 5+2. That is the maximum blood which is drawn in this study. So means
So-
like if we reduce one alicot, so it will reduce 1 ml blood at
Dr.
least.
Abhishek, anyways, chikungunya IgM ELISA would take only 50 microliter.
Yeah.
So the first aliquot itself should be sufficient for all the ELISAs. They can do
Yeah.
the testing and keep it.
Yeah.
And in case the paired sample comes, then they can test. I mean, that algorithm will have to be set from the sites. You'll have to authorize the labs to
Yeah.
perform, because this study is all sequential. You will trigger a testing only based on the result. So in the lab manual also, that's one aspect that we were proposing, to keep a time of only 24 hours for review of results, because you
Yeah.
need to take the next decision based on that. So you'll keep
So
the
what
sample.
if we use that first helicot only, the leftover sample for the
Yes,
paired
because
testing?
the freeze thaw, two freeze thaws are there. So the lab, whichever is lab is there, it as a part of the quality management system, they'll have to ensure the sample integrity and chain of custody. So we'll have to put it up as a part of the monitoring also.
Okay.
Aliquot is not an issue. I think from the sample that we would be collecting 5 plus 5 ml, I think that's what we thought in 6 ml vacuum. It should be
Yeah.
adequate to prepare those,
Okay.
except barring some maybe male members of the packed cell volume is higher and we yield lesser. I think those things can be managed, because the last sample is anyways a repository sample. So there are
Okay.
cases where we don't get a repository sample. We should also be okay with that. And anyways, only 100 sample would be mobilized for print and all. Rest is anyways going to be at the site.
Yeah.
So only one aliquot, the first aliquot, that's going to be used for all the ELISAs.
Okay.
500 should be a good volume for
Next. So CRF 16 is about the follow-up phase. So here we are just looking for the lacto and scrub typhus, and also for the Vidal. So again the same thing for lacto and scrub typhus, we can add titers based on the earlier suggestions also. So the titers can also be added to this, and the qualitative result will also be added. So that thing we can just make minor changes. Any other suggestion on that? Because this is about the follow-up case ELISA testing. So I will move to the next one. The next one will be regarding the Vidal, and then followed by, yeah. So after that, yeah. So this will be about the Vidal. Again, if changes are required or we need to mention the titers and other things, so that can be added. But interpretation of Vidal is very means like very confusing, because many labs report in a different way, and other lab reports in a different way. So need some clarification from the lab. So if some lab person can intervene in that and help us. Next. Then the convalescent samples, and it is similar to what we are doing for the ELISA. So that samples are there. Uh, yeah, next. Again, these are the other samples. And similarly, like the baseline, we do have the endline samples. So that will be CRF 18, and we will have the chikungunya and dengue samples. So all that will be done. And these all are the CRFs from the lab, though they can be a bit modified based on the previous study and some other suggestions.
I think a few
So,
comments only, Dr. Abhishek, from
any
my
other
side.
questions? Yeah.
Yeah, just we can add some provision, because the reports will come from the lab. That will be the source data.
Yeah.
So once you upload this, I mean, put it up on the CRF, you'll have to link it with the lab ID or a unique number that will come on the date the report is received or something like
Yeah,
that.
that Neeraj can tell ki how is it possible to attach EDC with that.
Yeah, and no, even in the here
Yeah.
only the date of testing or date of report
Yeah.
receipt or something like that, and the unique ID,
Yeah,
lab
that is
ID.
there, and also we are also maintaining the hard copy format, so
Yeah,
it
but in
can
the
be easily
CRF it
linked up.
should be there, just
Yeah.
the dates, because everything is related to the date. So
Yeah.
and link it with the unique number the lab report comes with. Those
Sure.
two column at least should be.
So I think we are done with the CRF part, and definitely we have noted the suggestions. Yeah, please.
So if we are the lab who receives sample from the field, process it and send the aliquots to a second lab for the testing.
Yeah,
So the first thing is that how are we going to maintain the data, like electronically or on paper or both?
it will be on the paper.
Only on paper.
Only on paper, because the means like the field will only enter the sample the data on the EDC platform.
Hmm.
At the site lab you will be entering the results, but in between the whole process, like how it is how it reached to the site lab and which test has been sent to which lab,
Yes.
that all thing has to be managed on the paper.
Okay. And do we have any form like sample receiving form with the details of the quality of samples and the dispatch form like that?
Actually we haven't worked on the qualitative aspect, aspect of these samples and all other things.
Okay.
So that
But
part
that needs to be like recorded.
yeah, I think for the quality I think CDS is looking at that.
You saying
So
the sample
yeah.
transfer form from the field?
No, when we receive in the lab from the field.
Yes, yes. The all of
It-
the sites they use a log and have kept some formats also. When we sit in the evening, I'll show.
So
all-
we'll get that format.
Yeah, you'll from the field to the site lab
Hmm.
and then
The
processing
dispatch
and
form
how many
also.
aliquots are dispatched to the testing lab would be separate manifest. I mean, if you can possibly put it up in one format, it's okay. Otherwise, whatever happens from collection to receipt to processing to
yeah.
login, that
Yes.
at least that I'll share with you.
Okay.
Already few sites have the form. They can
Mhm.
review if they want to change it.
But do you have a
Otherwise-
format to
Yes.
record like the dispatch information?
We can do, I'll share the sample manifest. We can prepare whatever information you can maintain at the site level if you're sending out the samples to. That should not be an issue.
Okay, so for like that
So
site,
for all the
it's-
forms, logs, help with the lab, I would be available for
That
all
has
the
been
time.
shared
Yeah.
even.
Yeah.
We have shared the logs where like you will be tracking the samples, like when it is received and how it is stored, how it is processed, how many aliquots has been developed, and how these aliquots are being transported to a second lab,
Okay.
and when the results are being obtained. If you see the logs which we have shared right now,
Yes.
that contain that form. So
Okay.
that track is there. So you will have that when the sample has been collected by the field team, when it has reached to the site lab, when the site lab person or lab technician started the centrifuge of the sample, how many aliquots developed, how these aliquots are stored in which box and which location, means like the box may column and rows, everything.
Sample
You have to,
arrangement. Yeah.
and even a barcode will be placed on the boxes. So
Okay.
that is also there, and then followed by these samples will be transported to the respective laboratories.
Yes.
So this all track is already there in the paper format,
Okay.
which we have shared right now.
And this part will be on paper only.
Yeah,
not
this part will
electronic.
remain only on the paper. Only the result part we shall be entering on the EDC.
Okay.
Yeah,
Yeah.
and maintaining a hard copy as a backup at the site level.
Okay. Thank you.
Okay, even Neeraj is saying ki the number of aliquots developed, that part also he can incorporate. So he will just try to incorporate some part from the paper CRFs also. So he will just try and he will let us know about that. Yeah. But at present it is on paper. Anything else? Huh. Huh. And if any other logs, means like the site believes that they need, or we can prepare any other logs, so that can be prepared, and even sites can share the logs if they have prepared anything, or they have based on their past experience, if they have any other logs, so they can share with us or to all the sites. So that can be incorporated. Mhm. Huh. Yeah. Maybe other sites are using in their other studies. So if they want to recommend something.
I think all labs would have some good practice, they already would be utilizing. So all can be putting up together and can review each other's
Yeah.
areas and strengthen it further.
Yeah, but I think matlab, like we are not missing anything in these CRFs. But still, I am still open ki if you believe that something is missing or we are missing any special
The two,
specific
three
points.
important points were one would be this: there should be unambiguous chain of custody should be available, like wherever the sample has been there and kept long for how long, what temperature, and the other would be aliquot utilization. That's what reconciliation or the aliquot reconciliation we do. That another format we can give, and if it's not electronic, then the paper based you can maintain how many were used and what could not. Like the way we are doing currently also, if there's a problem sample, if there's a sample aliquot could not be prepared, you can prepare manual records for those and maintain. Those are the quality indicators to, just in case you need more training in the field and all.
Yeah, and we will try to have a dry run tomorrow, so that to have a better understanding on this. But still, I will request any site like AMC is sitting, PIMS is there, any other site is having any other questions to ask or any other clarity, because this is a very good platform that we can discuss all the things. And because it's just like a pre-final stage of the study, so like that. Yeah.
Like in the current study, although it's electronic, still there are manual records that the sites are maintaining.
Yeah,
KEM is
yeah. Actually,
maintaining,
constraint of time.
CMC, share and everybody is
Yeah,
maintaining. So those can be replicated as well. I mean, if some site does not have and they want to look at, can be shared between the sites. So,
yeah. So after this, we'll start doing the EDC part, and also some hands-on scenarios are also there to discuss. Like we can have just a brief discussion that how the study will flow. Though we just try to keep it simple, the forms and CRFs, so that there are no more logics we have to use. If this happens, so this form will open. This happens, so that form will open. We just try to keep it in a very simpler way, but still the suggestions are open. And Neeraj, should we start with the EDC part or should we start after lunch? Matlab it's like 15 minutes to lunch. So should we start with the scenarios? Okay. Okay. So Dr. Hema, can we do the scenarios? So if you can share the slides with them. Uh, नहीं नहीं let us let us do few scenarios to have a better understanding, and then we can go with the EDC part.
So shall we give our tabs to be, uploaded now so that we can work on it? Like,
There is one question from CMC Vellore online on the chat. Any site specific logs to be maintained for RDT kits storage? So there will not be any site specific logs.
Yes, we need to maintain as a part of the region management system, and it's also will guide the team on that. Because the consumption is in the online.
Okay. Actually, that's the photo for online card.
Yeah,
Once we are online.
with any test that will be done, agent etc. we need to track anything.
Do you have any comment for that?
Yes, and also the report format for RDT, because there's a tick number, lot number, expiry, everything is there.
So
That's
that
right.
log will be shared with the site.
Yes, it's in the part of the presentation also tomorrow.
Okay, so that will be shared now.
Lot number, tracking expiries, everything needs to. Okay. And PMC is already doing that also.
Yeah. We have just developed few scenarios. Though we didn't got that much of time to prepare them. But just to bring the clarity, and even these scenarios we can use while filling these forms, because such kind of situations we will end up. So Dr. Hema will take us through these scenarios. Dr. Hema.
So I will request everybody to just try to fill this on their paper CRFs. We are not doing ADC. We're just going to do it in the physical form. So I'm going to go scenario by scenario. So this is the first scenario. This one give it out. This is Arvinder, son of Virendra and Mrs. Rajni. He's a 25-year-old male. Date of birth is 1st of Jan 1998. He's a permanent resident of the city area of Northmore, belonging to Hindu religion and Hindu. His family consists of 4 members, all the 4 are adults. The age of the father is 55, the age of mother is 54, the age of the son is 25, and the daughter is 20 years. He consented to be a part of our study on 10th of April 2023. On the day of consent, he was found to have a temperature of 37 degrees centigrade. So I would request all to try and
we can discuss whether should we can we screen this participant or not.
yeah.
So I will request sharing the mic.
Not sharing the INI.
Sharing the
As in our study, 18 years minimum, 18, below 18 and no 18 is required.
Yeah.
And 4 members are less 18.
Yeah, so that is the reason that in that household we are not having a below 18 age. So that's why this household will be excluded from the study. So that's why we cannot take them or we cannot enroll them. Besides that, all other categories will be, but still because of that we cannot enroll. Temperature we are having 38 degrees Celsius. So still we can go through with that. Sir, you want to add? And like the criteria we place that one person should be below 18 years also, but that is yeah. Yeah. So yeah. But you know, we will manage with this situation. Yeah, that we scenario where you have to request the participants from this challenge. So my other gender issues are yeah. I understand your question. So because this was like finalized during the last meeting, when every site was there, so it was decided that what will happen, we will enroll all the adults first, and at the end of the towards the end of the study recruitment, we will be end up with only the children. and which will be very difficult. So it's like to avoid such kind of a situation, we have suggested that it should be a part of the study that at least one person below 18 years should be enrolled from each household. Because people generally don't go with the children first; they will go with the adults first. So that problem will we will end up in that problem situation. Dr. Abhishek, but at what point of time there will be a case when all the children or the adult will be enrolled from the parent or from the household or the from the study that age group will be fulfilled from that cluster. So how at that point of time how will we proceed further in the mean if for this screening of the household we require minimum one adult and one children child. Yeah. So we can screen those. That is the minimum requirement. You can have more than one adults also from one household. So in that way we can keep that balance. Yeah. So that is the point because like we can have three people from one household, two adults, one children. So that will suffice the number for the adults also. And since we are keeping a daily track of number of individuals in different age groups, so we will know that we need to add more adults in those households in the eligible households. So in that way we can manage that. That means we can decide which individual we want to enroll on. Yeah, because even actually in other words, if I say in a household with a less than 18-year individual, you are approaching every individual in that house. Yeah. So basically, you are excluding those who are refusing the consent. It's not like a choice because choice so will come when you have a limited number of people. But now you are taking the entire household and you are excluding only those who are not consenting. So that is the situation. So, basically, I want to confirm even after some time, there will be cases I said that all the 2 to 18 enrollments have been done. Yeah. Then after we have this, only the adult members need to be recruited. Yeah. So, as we discussed earlier, we discussed minimum two individuals, one child, one adult will be enrolled from the same household. Yeah. So at that point of time, we don't have any child for the age group left to be enrolled. So that's the question. Yeah. So we enrolled or what would we do at that point?
Yeah, I totally agree. And yeah, so I think if you have 50-50% less than 80, then
below 18 years, it will be somewhere around 30-35%.
so it's not possible that this scenario can we will left with we will have all the children, but adults are not completed. So we should not be stick to this.
So the point is again the same thing. If we remove that clause of having 14 in a person with above 18 years and below 18 years, so it's quite fine. We can do that. But at the end, if we are left with the one particular age group, then it will be a problem. So that is the only challenge.
Even we should not restrict to this criteria. If we get a one child from one household, then we should take. It's up to site whether they can take it. We should remove that clause. It should not therefore building with the household.
Yeah.
So maybe
the other thing will come up because we might land up with only adults at the end of the study.
but they will have to in process from this. It's not possible if they are getting a child, then we can enroll them.
Yeah.
So this is keep it open. Otherwise, they will be always whether they are fulfilling then there is a lot of or fulfilling that criteria. So it's better
Actually, the important thing is we have to have adequate children. Because that is the more among children only the prevalence will be to case on the COVID surveillance, which is 2 to 7 from prevalence and 8 to something other prevalence. And among 18 years, almost similar. So if it is 50% children and 50% adults, it is well and good. We are more worrying about the children's population. So we need not have it is not exactly that each age group have the same percentage of population, but we have to give more importance to the children's population, younger population. So we should ensure that at least one household, one child will be there, get 30 to 50% of children. So we need not adult population. So that is adult population is good because we never the sample is based on the side age groups, but we should have adequate representation for the children.
Sir, in that case, we are already doing the age stratified, so we will just keep a track of the numbers that under each age group, these many numbers should be there. In and around that.
इस मीटिंग में जो ऑडियो फीड जा रहा है वो किससे जा रहा है, माइक से जा रहा है,
तो
ये
next
दोनों को
scenario-
कैच कर रहा है इसमें और फिर इधर से जा रहा है। तो इसमें क्या हो रहा है, थोड़ा थोड़ा सा बीच बीच में ब्रेक, मल्टीपल माइक्स ऑन होते हैं ना जैसे, तो बीच में ब्रेक नहीं होता, आवाज एक दूसरे को कट करता फ्रीक्वेंसी मैच करने के लिए, वो वाली प्रॉब्लम हो रही है, इसलिए उधर पे क्लियरली सुनाई नहीं दे रही। वो क्लिक करने अभिषेक अच्छा म्यूट करना उसको चलेगा। समझ आ रही है इससे अभी अब ये बोलेगा ना, अब सुनना है, इससे आवाज क्यों आ रही है?
So this is the second.
This is Deepak, son of Mr. Later, this is Sajani, he's 20-year-old male, 28-year-old male, the date of birth on 1st of January 1995. Born at Western Study area of Badu, belongs to the related and general caste. His family consists of 4 members, 2 adults, father is 28, mother is 26, son is 5-year-old and a daughter who is 3-year-old. He consented to be a part of the study on 10th of April 2023. On the day of consent, he was found to have a temperature of 37 degrees centigrade. His son is also ready to be a part of the study, consented to be a part of the study. The botanist is able to extract the sample from both the parties. The question is, can we see this household of the individual?
So I will ask the PIMS team to answer that. So now that clause is the means like we are just planning to remove that clause. After that clause, we can enroll that part. Any other side you would like to add? RMRC team. Asset means that we just take it because it's a children. But definitely it works after 7 years of age. It's only area. All 4 can be enrolled. Okay. Yeah, the question from Dr. Nandini is about the answer of both the scenarios. So, ma'am, like as per the existing protocol, we will not enroll in the scenario 1, but as the recommendations by the group, we can enroll such individuals because we will remove that clause of having an individual of above 18 years and below 18 years. In that case, the scenario 1 will become possible and we can enroll that individual and all other household members. And for the scenario 2, definitely we can enroll even with the existing protocol. So that is possible. As even previously has told. Yeah, in the next slide.
I just have one concern with training information on tasks. we won't be able to obtain past information in our site, our EC won't approve. And because the form which we submitted to EC did not have caste, it only had religion. Even in phase one, we used only religion. Religion we can obtain, but caste we won't be able to.
Sir, this information we are taking free. We are not we say obtaining from the community. So
No, we'll have to obtain it to actually fill up whatever. So we won't be able to obtain.
So means that can be that part can be removed, but definitely based on the suggestion from everyone.
So even our site
For every site we can remove it. I think the general demographic information we can remove that. We can exclude that part. Dr. Shikha, did we have past in the census? In the census. No, but it will be fully filled, so he needs a common platform. Okay. I think that will be very difficult. Exactly. It's a mixed type of
As such, when we go to the community and ask them a lot of questions, there is, they don't want to record. I mean, in fact, people are hesitant to share their Aadhaar card with us to actually obtain data because they are worried that, we're preparing them for something. So I really think we shouldn't ask that last question, but ask whatever. I mean, you might say it is OBC, BC and all that, but that categorization itself, in fact, that the president and so that's what is actually gone to our UC. So we won't be able to fill that. From our But where do we get our census data from? Yeah, our census we do not obtain that. Yeah, we don't obtain that. We say not obtain.
So, should we remove this clause? What is the suggestion from the group? ये वाला caste वाला. We can complain. So we can keep it an option.
Hi, Abhishek,
But
can I
for the
interrupt?
analysis table development, we might need.
Hello, Abhishek, can I interrupt? Hello? Hello? Abhishek, can you hear me?
This is just an information like how we will fill the CRF3. So this is about the contact information. We have to click the verified and all that. So in this scenario, we have opted. So will that suffice, or does the site believe that any other information is required? So you can just see, scroll down the forms and just see this part, and then you can move to the next.
The socioeconomic status of Mr. Deepak was captured as per the NFHS guidelines and on 10th of April 2022, the study being initiated the baseline civil survey workup. So here are the details. He is found to be a diabetic for the last 3 years. They have a prescription reporting the same. The temperature on the day of baseline civil survey was 37 degrees centigrade. A second reading showed it to be 37.1 degrees centigrade. The blood pressure was 120 by 18 mmHg. The second reading was 122 by 17 mmHg. Weight was 65 kilograms and height was 170 centimeters. What all source documents the site will make. question is what all source documents the site would maintain.
Yeah. Description of diabetes. Yeah. And any other?
Baby sheet.
Which one?
Baby sheet included.
Yeah. And for- so it will be basically about the diabetes prescription that you have to maintain at least, and only keep a copy of that prescription to ensure that the participant was diabetic. Apart from that, I don't think any other document. But if there is any other suggestion.
It's just a previous scenario. We just want small clarification. This scenario, they approve the timing, they come for the timing is between 9 a.m. to 6 p.m. Our field working hours is like till 5 with the.
Yeah. Yeah. Okay. 9 to 5 or the field working period. What time? Okay.
So going ahead, so Mr. Deepak, the point of care test that has been done, the hemoglobin is 11.2 and the RBS is 245 milligrams per deciliter. A sample collection has been done on 10th of April at 10:30 a.m. The volume is 3.5 ml.
So again, the same question. What are the document to be kept at this stage? Yeah. Yeah. If any online participant wants to answer. I'm not able to see the names.
Dr. Nandini is online.
Yeah.
Dr. Nandini, are you audible?
Yeah. Any other online participant would like to take this question? What all source document we need to keep at this stage?
Not able to hear and they are complaining.
They're not able to hear it.
Clear.
Okay. So now, yeah, you can just ask the audience here. So, APT, would you like to take this question?
Like CRF 5 should be.
Okay.
So only zeros and the CRFs will have.
No, we are just asking ki what all documents to be maintained at the site as hard copies. Yeah. Ma'am, sorry.
Report of point of care test.
Yes, ma'am. Annual sample transportation logs will be there. So that has to be maintained. But in case of the point of care test, there will be one referral will come. So that has to be properly signed and sent referred by a medical person. So that thing has to be taken care.
I have a doubt here, like, it is one RBS reading.
Yeah.
So we should refer him and we should follow what happened in the referral.
Ma'am, the next decision means that medical decision has to be taken because this is not a normal reading.
Yes.
Above 200, the RBS is coming. So the medical person will take the proper action. That the
Like,
control.
it is
Yeah.
kind of like his first time diagnosed. It is diagnosed.
This is already a known case of diabetes.
This is a continuation.
So a referral or the further action has to be given for the ethical reason.
Yes, and that should be documented.
Yeah, that should be given to the participant and a record to be kept. Anything else?
Supposing it doesn't go for a follow-up, I mean, it's up to him, no?
Ma'am, I think we can just go till refer that participant. Rest is so as per his disposal, but.
Yeah, it's only a one reading of RBS.
We can ask for an equivalency or something like that. So that can be recommended, but should come from a expert person. So that is the thing.
Where we are going to keep that referral of we are going to suppose where we are going to mention that we have referred.
Yeah, that's why I'm saying that description or that format, the site, because that format is yet to be defined. But if site will provide them some format or some kind of a prescription, so a copy of that prescription will be kept with the site.
Prescription or a report.
It will depend, like a medical person is giving, so even a prescription can also work.
So, on page of field sample collection, medical person is not going there and he is not assessing the
Yeah.
participant. So based on the sample, he will be writing something or he is only referring.
We can refer that because that numbers will be mentioned even on the EDC. So any action has to be taken by the site team. Because since it's an abnormal reading, so you have to give some suggestion to the participant. Because we are just following it up. So maybe not immediately in due course of time, but it has to be given to the participant.
Well, Dr. Abhishek, like I have another doubt here. So this point of care test is done by a field person.
Yeah.
So he will report it to the site. So site will send the designated medical person.
Yeah.
So is there any time frame which is fixed in the EDC
not
to
yet.
open or close?
Not yet. But this has to be means like it will become a good practice that if you just refer them and give them the.
Yes, because
and-
it should be clear, so like if you mention that, okay, we have seen some person with the more than 200 athletes here. So we have inside medical officer in place,
Yeah.
so he should go within this time frame, it will be better across all sectors.
I think, but that is not our objective. So we cannot define it under the protocol or anything like that. So it can be in the site SOPs can be done, but not in the
Because
protocol.
site activities are going to be uniform across all sites.
Yeah. It can be placed in the SOPs, but not in the protocol. It's more.
Detected out of this point of care testing, that definitely indicates further action in terms of referring it, whether the organization or the institute have their in-house facility where they can internally refer to their hospital or clinic. That's one. If that facility is not there, but there has to be effort where this kind of abnormal reading the persons have to be referred somewhere for further evaluation and management. So it's more a ethics point of view than anything else.
Yes, sir.
I'll just describe what we have done because this is not an uncommon scenario. You will find because about 20 to 25% of all our population was diabetic, another 20-25% was hypertensive, and anemia was also around that range. And the other problem you'll also find is obesity and severe undernutrition. What we did, we've actually trained all our field workers, supervisors about these common things, common NCDs, and told them and given them handouts, like, what respective this thing. I mean, this is not from CMC. I mean, this is actually from the government urban health center. So I think all of these can be possible, but finally it boils down to each site to actually develop these things.
Yes, sir. Sir, I think it's a valuable suggestion, and that can be done. Means like we can train the field workers with the normal ranges, and if anything comes beyond those ranges, so immediately can be brought in the notice of the medical person or the respective and they can refer them to the respective hospitals, so that the patients can be taken care immediately. So I think that can be included, but I still open it for the other sites if they have any other suggestion. Sir, any suggestion on that?
Abhishek, so in RFA2, we also implemented the same thing,
Yeah.
and we roped in all the PHC, CHCs, government hospital nearby, near our sites. And in each of our teams, field team, we have one ARO who is MPH at least. So they format is also developed, uniform format was also developed.
Okay.
On that format, we used to give this information about BP and abnormal blood sugar and everything to the participant. So
Okay.
entire system was placed in the RFA2 also.
So how was the experience and how was it tracked?
It was good. Like we used to give all these information to our participant who have abnormal value or normal values, irrespective of those things.
But ma'am, the challenge was the involvement of the medical persons. As I know, involvement of the medical persons.
Okay.
Because that has to come from a medical person, or that has to
So
take
basically,
care.
in community like CMC has shared, it is very difficult to involve in this such kind of study medical person for each cluster. It is very difficult.
No, but
So these are
common
some
for
of the
all the
ways
clusters.
out how we can manage this
Yeah.
such situation. Once we have referred, then they are the responsibility of the nearest hospital.
Yeah, but actually we need to explain the entire problem to them also. So
Yes,
there-
yes,
there- yeah.
that is
Okay. Any other suggestion from the sites? Okay. So the next thing, like in this case, we have just tried to figure out that if the participant reports fever in one of the follow-up dates, so and his temperature was recorded as 39 degrees Celsius, 40 is to being very high, 39 degrees Celsius, and he's saying like last 3 days I am having the fever. So what should be the next step? KM team, would you like to add? The scenario is key in one of the day the participant has reported fever on the weekly follow-up visit. And what all CRFs should we go around? Registration. Then the next will be screening. After that,
Fever workout, that is sample will be
fever
collected.
workup.
Yeah.
So we will go with the acute phase sample.
Active phase sampling.
Anyone would like to add or differ from KEM? SAS team. SAS team, any other suggestion? Or you differ from KEM teams?
We agree with the earlier team.
With the KEM team. Okay. PIMS team. Okay. So here we are having a fever and which is more than 2 days of duration. So that's why we will go with the fever registration followed by fever screening, and possibly as per the given information, the participant will meet the criteria for AFI, and then we will go with the AFI surveillance. An acute phase can be initiated for this participant. So yeah.
Continuing on the same participant.
So the participant did not seek any healthcare in any facility. The research team recorded a temperature of 39 degrees centigrades on the day of the visit. The fever was associated with backache and loss of appetite, and no other symptoms were reported. Rapid diagnostic tests were performed, and the results are as follows.
So in this way, we can just fill all the information. So now again the same question: what all things we will again keep at the site? Because if we have these many tests done and the results were obtained, so what all things we need to keep at the site level?
Like a photograph of that malaria positive kit.
Yeah.
We should maintain, and we should notify this to district malaria and BPCD authorities and make
Yeah, to
sure
the
that he got the
government,
treatment.
yeah. And also the RDT kits for dengue also.
Dengue also.
Though it is for the
anyway-
patient care, but we
no,
will
it is
keep it.
anyway, and BPCD will cover everything. They'll take care of the dengue and malaria. Authorities will come, and we should maintain the record of all these tests as a hard
Yeah.
copies.
So, anyone would like to add something or differ from a Shillong team? The Palwal team is basically developing all this.
Would you diagnose this case as a dengue positive as per our research or not?
No, I am just asking ki at this stage, what all documents will you keep at the site level?
So
If, the results, RDT kits, RDT kit results. So what will you keep?
Like for malaria and RDTs.
Not the kits. You will take the photograph and keep that kits because the results can change as it was discussed. Na? Results may change. So you cannot keep the kits. Kits can be discarded, but only the photo or the a photocopy can be taken and that can be kept at the site. And that has to be properly verified by a medical person. Are you able to understand? Okay.
The acute phase sample for lab diagnosis was collected in plain and EDTA vials, and this is the table showing the ml, 6 ml and 2 ml. Plain vial sample was processed, and 5 aliquots were.
So if
Okay.
any, just
Yeah.
so if anyone can tell me the 5 aliquots, what they will represent? RMRC team.
The purpose of doing that, is there any added value or for doing, measuring these?
For which testing these aliquots will go?
They've asked about CMC side, biorepository.
Or do we need to develop 5 aliquots, 4 aliquots, or 3 aliquots? You differ from that.
They thought you were here and
QPCR, one for QPCR.
Sorry, not audible.
Not audible. You just need to be a little louder. You're actually audible.
One for QPCR.
Okay.
One for QPCR, okay. One for biorepository, okay. You have taken the easiest answers. PRNT, okay.
Dr. Abhishek?
Yeah.
Aliquot 1 will be for IgG, IgM,
Yeah.
ELISA. 2 will be qPCR.
Yeah.
And the first one, again, as we discussed yesterday, would be for chikungunya also.
Yeah, but as it has been recently discussed, na, we will have the 2 different aliquots because chikungunya will not be processed at that stage.
Yes, we stick to 5 then.
Yeah.
Third would be PRNT.
Yeah.
Fourth will be chikungunya, and 5 will be biorepository.
Biorepository. Yeah. Thank you. ELISA, they have told.
NS1 ELISA.
NS1 will be part of the dengue ELISA. So just to means like bring all the things together. Like the first aliquot will be for the dengue ELISA, which include NS1, IgM, and IgG. Second one will go for the qPCR. Third for the PRNT. Fourth will be for the chikungunya ELISA, and the fifth one for the biorepository. So in that case, so now though the scenario we have ended here, but just to take the things forward. Suppose if that person comes to be positive through NS1 ELISA, so MAMC team can tell me the next step that NS1 ELISA is positive for that participant. So what should we do?
Irrespective of the diagnosis, we have to do ELISA, right?
No, yeah. So you have sent the first
I didn't
aliquot for
follow
the
the
processing,
sorry.
and the result states that NS1 ELISA is positive for that person. So what should be the next step?
The next aliquot was for qPCR, right?
Yeah.
NS1 is
So
positive.
Dr.
then
Meenakshi,
we-
you are helping.
No, no, NS1 is positive, qPCR. If it's negative, we do PRNT, right?
Yeah. So we will go for to identify the serotype of dengue. So that's why it will go for qPCR. Acha, now the second question. It will be like NS1 ELISA is positive and IgM is also positive. So what should be the next step? NS1 ELISA is positive and IgM is also positive. What should be the next step? PIMS team, you want to answer?
But what we thought yesterday was one alicot will remove it. We'll remove one alicot and add it to the alicot one only.
So just to simplify, should we send the sample for qPCR or PRNT? qPCR or PRNT? Everyone agrees with that qPCR. Voting.
Because instead of doing paired testing,
PIMS team is still discussing.
for chikungunya IgM, it takes
Huh?
in the first 5-6 days it will not appear. It will appear only later.
IgM, I am saying IgM positive and NS1 is also positive. So should we go with qPCR or should we go with PRNT? MAMC team is in favor of qPCR.
That's what they were saying. No sample. If suppose insufficient samples are there, we can omit that.
Share India would like to take that answer.
Out of syllabus.
We'll just clarify on that. Finally, they didn't decide what to do. They said one was saying no paired sample, one was saying finally she said it might be enough. 500 micro, it might be enough.
Any online participant would like to answer?
Sir, qPCR sir, from sharing.
qPCR. We will go with qPCR because if NS1 is positive, then qPCR is possible. And like the main aim is to identify the serotype of dengue. So qPCR will suffice. We don't need to go for PRNT, which will in any case will be means like not cost effective as well as it will take time to get the results. So we will go if NS1 is positive, irrespective of IgM results, then we have to go for qPCR. We cannot leave that. Then if NS1 is positive, you have to go for qPCR irrespective of IgM results. Achha, now after this acute phase, on day 9th, we again approach this participant and it is found that this participant is febrile. So what should be the next step? AMC team. Day 9 and if we see that that participant is still febrile.
We go for Vidal scrub typhus ELISA.
Yeah, follow-up phase sample. So we will go for testing the all the three things like Vidal, typhoid and lepto. Yeah. And like after this follow-up, if I say that on day 14 the fever subsided, the patient and he has reported 3 days of non-febrile condition. So what should be the next step?
Convalescent dengue and chikungunya testing.
Should we go with the convalescent phase or not?
Yes.
We will go with the convalescent phase to find the diagnosis of dengue and chikungunya. I hope this is clearing a bit of doubts. Yeah. Yeah. Okay, so let's have a break. Questions.
Write the end date, end date, and what happened. Now that's what they were suggesting.
For the online participants, we will join back after half an hour. Rahul, half an hour.
Not taking any antipyretics for the last 3 days. The blood pressure reading was 122 by 80, and the second reading was 120 by 78. The body temperature was 37. Acute phase sample came out to be NS1 antigen positive through ELISA and ICM negative and IgG negative. Will the follow-up sample be collected or not? Okay. And what will happen in the convalescent phase? Which samples will be collected in the convalescent phase? Anyone?
So what is the scenario?
Scenario is that this NS1 antigen is positive, given IgG negative. Will the follow-up sample be collected, and what would it not? What will happen in the convalescent phase?
So first question will be like, which test will we go in the acute phase? Like NS1 is positive,
follow-up phase.
but IgM is negative, IgG is negative. So again the same thing. qPCR. I hope it is clear now. MEMC team, RMRC. Is it qPCR or PRNT? AMC, it is clear, or do I have to tell? Okay. So now the second thing, ki,
In the follow-up
the participant is not having any fever after 7 days. Okay. And maybe it was a dengue because NS1 was positive. So what should we do next? Like it is day 8 or day 9. So should we go for another sample, another testing, or not? SAS team? No. So we will not go. You're right. You all are right. That because there is no fever. Okay, irrespective of the diagnosis established or not, if there is no fever, so we will not go for the second phase. But what about the convalescent phase then? We should go for which test? For the chikungunya one. Yeah, we will go for the chikungunya because dengue is already there, NS1 is already there. But we have to go for the chikungunya, so that's why the convalescent will come. Otherwise, there will be no need for the convalescent. So that will come up. Anything else? Yeah.
Will we accept this report from CHC lab? Yeah. Abhishek, yeah.
Well, point I can't comment, but the point from the reporting to the study, that will definitely be considered because that is from the government system, and we shall report it in our document that such report has been means like it has been generated from the CSC.
So that means if our lab is not NABL accredited but is a government lab, we can rely on its reports.
I think we can go.
Okay.
In the same case, on a follow-up visit on 31st of May, Deepak had no fever, no other symptoms.
We've discussed this part.
Yeah.
Convalescent sample. No?
I think that's it. That's the end of it.
Okay.
We can go to
So these all scenarios were there. Okay. And next two things are there. One is the certain logs which we want to discuss, and then we will start with the EDC part. So Neeraj, should we start with the logs first or with the EDC? Did any site got a chance to look at the logs? Okay. So Neeraj, let's quickly complete the logs then. हाँ, फिर we will start with the EDC. एक कोई हार्ड कॉपी है क्या लॉग्स की? नहीं, प्रोजेक्ट की जगह ना हम लोग नीचे में ही बात कर लेते हैं. So the first one is the daily diary log. So this log will help us to track, like we should not miss any calls or acute phase visit or the convalescent phase visit. So this log will help us in that. So it is easily possible. We will replace the word weekly call with a weekly visit. Uh, that is a typing error. But this will help us to keep a track of on a daily basis, like what all acute phases has to be visited, follow-up phases to be visited on a given day. Otherwise, a lot of confusion will come up because uh, some people might be in the follow-up phase and some might be in the acute phase and some might be in the convalescent phase. So too much of confusion will come up. Otherwise, if we don't make a log, so this log will help you out with this part.
Hello?
So the first log, diary log, is for the research officer. So whatever work they will do on daily basis, they will have to put the summary on the daily logs. So which need to be cross-checked with the each their other logs so that it can be linked with that. Like suppose if they have two fever cases in that particular cluster, so they have to mention here how many fever cases were reported. And suppose if they have make any visit for on acute phase, same for the follow-up visit, so they have put the they have to put the summary on that, and which can be verified by the their supervisors. Yeah.
Neeraj, if you see this daily log, instead of keeping this as a hard copy with the site, can't we have a dashboard for each site?
No, this is we need this log to match the data with our software. Okay, so that's the main thing, because sometimes what happens if their data is not uploaded or they have missed to enter the data into the tablet, so it can be cross-checked with the logs. Okay, so identify the missing data and everything. We need a log so that we can link it with the software.
But the field team or the medical doctor will fill this log by looking at the, their tablet only, no, means whatever they have entered.
The tablet, we are using tablet only for the data entry purpose. Okay,
So from
not
where
for
I will get this number? Suppose I'm a
this
data
is
collector.
like their work what they have done. Okay, in the lab, in the field. So they have to fill the form. Okay, if they have captured like data for the two fever cases, so they have to put the summary in that they have entered the data for two fever cases.
Whatever we need to fill in this log will depend upon what we have entered in the tablet.
That you are assuming. Okay, so in the data, suppose if data is not uploaded, but on the server, once the data is uploaded, that time we get the total count. Okay, so for you, if you see that they have reported two for fever cases, then you can check in the server data. You will get the data link. You can download it. You can generate the reports based on the data. So that means option is there, but you need to cross check whether if there were two cases, whether it is has been reported into the EDC or not.
Yes, but see, now suppose I'm going on the field. Okay, I have visited 10 household. Out of 10, I have came across 3 fever cases. Okay, so one by one, I will document on this also, correct?
Yeah, you have to prepare a log sheet.
This I will have to fill at the end of the day.
Yeah, end of the day.
Because it is going to be the summary for the day for that particular field worker or the medical officer.
Exactly.
So Dheeraj, just to clarify further, like if you see the fever tracker, in that you will start entering all the fever cases. Like if you report 3 cases, you can start there. So now that tracker will initiate. You will know when the acute phase sample has to be taken for this person, when to take the follow-up and when to take the convalescent. So that tracker will be developed here. Only the numbers will come up in the first one. Like you say that I have reported 3 fever cases, but it's not necessary all the 3 will go into acute phase, because some might be in first day or second day fever. So then you will write that like 3 cases in the expected, and oh sorry, in the observed, not in the expected. But in the expected, acute phase visit will be 1 or 2 maybe. It is not 3 exactly. The first one.
Okay.
Okay. Then followed by the convalescent. If you have some fever case 10 days old, so they might be going for the convalescent. Similarly, the hospitalization reporting visits. Okay, and the death reporting, the number of persons for whom verbal autopsy has to be done, or the number of persons whose hospitalization records has to be extracted. So this will give the field team a brief idea what all activities they need to do on a given day, so that the activities will not be missed, because a series of activities are there. The first thing, they have to do the routine follow up. Second thing, they have to do the fever, means like the fevers which has been identified, they have to go for the acute phase, they have to go for the follow up phase, they have to go for the convalescent phase, and also hospitalization records and death records. So that summary should be there with the field worker while going into the field, so that there should not be any confusion. uh, any other side would like to add or something? This is the first one. So this is the summary which every field worker or field team will carry while going into the field.
Dr. Abhishek,
Yeah.
if there is a weekly call of 30 participants today,
yeah,
only 20 can be happen by phone or home visits.
Yeah.
10 are pending.
Yeah.
So those 10 pending visits will be included or added to the next day visits.
Definitely, because we are having a window of yesterday we had a discussion on that, and now still we are with the 1 or 2 days window. So that has to be done in those 1 or 2 days, not beyond that, because after that it will go into the next week.
So all the points are valid, but point number 2, where the fever case is reported, where when expected, how can
Expected will be will not be taken care in that. It will be only about the observed.
Okay.
That means we are having 4 clusters, suppose.
Yeah.
We are having 4 clusters. So we will be maintaining 4 separate seats for each cluster, each seat. That is.
Yeah. For each team, not each person. So if we are having 3 clusters, so we will have three sheets. But they should have their work plan in hand. Otherwise, it will be like if we miss that case, we don't remember that case. So that would be a problem. So they should have their a brief idea that we have to approach these many people in the given day. So that is our work plan. I hope this log is clear.
Is
And if
EDC not providing any due lists?
any question, or you understand the concept?
Hello.
AMC team, any question on this? MAMC team, any
What
query?
is this? Yeah, what is this fever expected? Expected
So
and observed.
CMC team, clear. Okay. So
Expected and
moving to the
observed, I
next
can't
one.
understand.
One more, Dr. Abhishek.
Yeah, Dr. Abhishek.
After doing the enrollment at the baseline, does SOMART will provide the due list for the weekly visits, for the acute phase sample collection, follow-up sample collection? Any software?
For the weekly visit, SOMART will provide, because what will happen in SOMART, like if you have enrolled the person in the baseline zero survey and you have collected the sample, the AFI surveillance will start weekly follow-up. So every week you will have that pop-up of every individual who is scheduled for that day.
The pop-up or Excel file will also be downloaded from the software?
No, actually, in the system, there is an option for follow-up visits. Okay, so that thing we can customize in the system. And for every 7 days, there will be a call will be generated, and you complete it will go off. Okay, from the list. Okay, so for the weekly purpose, we have done that. Okay, but for the fever cases, the acute phase, follow-up, convalescent phase, we have kept it open. So you have to take the decision, because last time in the previous study, we have noticed that if there is any follow-up, then there need to be some expiry also. So that form need to be expired after some time. But what was happening, due to some reason, the form was not filled and form got expired. So that was the main challenge. So we have kept it open. You decide and you fill it, the data into the that forms. Okay. But the tracking you will have to do in the fever tracking form. That
On
one
the
you have
portal,
to do.
on the portal itself only, or the there will be any Excel file which can be downloaded from the Somart portal.
नहीं, anyway, there will be no Excel sheet, but you can download complete data and you
Okay.
can generate whatever you want to do. Okay, so everything will be there. Same as this, we have created a link to download data. Okay, you were in Soma 3.
Yeah.
So, but for the all the COVID study, there was a link from where they download the complete data set. Okay, same like so even in RFA 3 side also you have link to download the data. Same you will get. Yeah.
Dr. Abhishek, one doubt.
Yeah.
I might have missed. So what would we fill in for fever cases reported, expected, or observed? Like what is
For the fever, it is told that there will be no expected. So
Yeah.
that that column will not be considered. Only the observed cases will be noted.
only observed, right? And the
Yeah.
first one is clear because how many are expected to contact and actually how many. Okay.
Yeah.
Thank you.
So just to move to the second scenario, yeah, second one. Second log. Yeah. Dr. Alok, I think the same question which you were asking. So, Dr. Alok, the means like the due list will not be available in the form of an Excel, but it will be available as a pop-up in the software. So it will be like that. Uh, the second one. So the second sheet is the participant log sheet. So this sheet we will means like every site can have it as a type of a diary for each participant. And this will be a tracker for the entire 1 year, like how that participant will be tracked. Like if we are calling that participant in the week 1, so what is the status, febrile or afebrile? That's all. And the date of contact. Similarly, is for the visit 2, visit 3, week 2, week 3. Yeah. it is just opening. Second. Participant log sheet. नहीं, Last. ये. So in this log sheet, this will be for the entire 1 year for one participant, where we will be looking after all the 52 weeks to be taken care. And if any fever case is reported on any weekly follow-up or any call or anything, so that will be taken in the fever reporting, which is means like in a
So if you see on the top of the list, so here you have to mention the study ID, participant name. So you can put the name which has been recruited and the study ID. Then you can, if you want, you can also mention the census ID and date of concern and the contact number and the preferred time for the visit. So that research team will have an idea when they can go. Okay, and according to that, they can date of consent is also very important. So based on that, only the weekly schedule will be generated. Okay, so if there is any mismatch even in EDC or somewhere, so they can easily identify through this tracker. Okay. So here in the we have created 52 weeks columns and cells. So in that we have the status whether the weekly visit was completed or not, and on which date they have completed. So they have to specify it.
So
And
this will be a hard copy or
this will be the hard copy. You need to print a booklet. Okay, of all 750 cases.
Cluster wise, basically.
So cluster wise, yeah, cluster wise that will be. Team. Okay, so even for in the fever, we have the we have also prepared the fever reporting. Here you will you will assign the fever episode ID also. So from this here you can specify this is fever episode 1, episode 2, and this episode detail need to be entered into the EDC also. Okay. इसमें ये भी फीवर बता रही है ना fever ID will be generated by the system and which need to be put into the log sheet.
And if someone reports any fever, so the this one, the fever episode ID and this phase will open up, where we will have the dates and whether this means like this phase has been completed or not, acute, follow up or convalescent.
We can also add the end of the fever date also here.
In the CRF, CRF number 7, fever registration, fever episode ID is mentioned as ID can be added as FE1, FE2, FE3, and manual account of number of fever episodes to be maintained.
Yeah. So this will help you to maintain that. If I'm having the first fever episode, it will give me FE1. If I am having second episode, it will give me FE2.
So we have to
manually generate that.
mention it here manually.
Yeah.
And cross check with this sheet. Na?
Yeah.
In CRF7, it will be generated manually or
The CRF will be it's like a registration form. So you directly click on the fever registration, it will automatically come up. Then it will give you the option of all the participants which are recruited in that cluster. So once you click that cluster, so then the other things will come up and then you have to enter the other details. So FE1, FE2 will come up from this log. That this log will generate FE1, FE2, FE3 because you are having a track of all the fever episodes.
So we have to manually enter this FE1, FE2
from this fever
From this record, yeah.
And the fever UID is there that need to be like written from the EDC.
EDC.
What?
FUID
Fever UID, yeah. So that will be generated after the registration.
Okay.
Where it is mentioned in the
So there
that is what we are mentioning now. ID can be added as FE1, FE2, FE3.
Previous page. Yeah, this one.
In this,
So this FUID.
If in participant log sheet there are two, fever episode ID and FUID. Okay. Okay. 1, 2, 3, 4 we can give it as 1, 2, 3, 4 all.
Neeraj,
Yeah, this one.
about this weekly home visit in which you have shown all the 52 weeks, just a suggestion if possible, the moment we screen the participant, all the future dates will be automatically calculated, right? The system will have that. So what I was suggesting, so in this table, if we can add the expected date of all 52 weeks, so
in the EDC is not generated. It's not pre-generated. Okay, it's generated like once you complete the like week 1, then the next week we generated. Because the reason is that because if there is any case of death or out migration, so we don't have like we will not have 52 weeks.
But
Okay,
that is okay.
Okay,
We-
so
we
that's
are-
why system generate on like once the one visit is completed, then it will generate the next.
Neeraj, that loss to follow will be a normal process for any of the participant. It may happen within a week or it may happen at the end of 51 weeks. So my suggestion is the moment someone is enrolled in the study, the system can give this table with an expected date on which the date of that week. So, and we will take a printout. You see, we'll
Yeah,
take
that
a
can be
printout.
done. That can be done.
That's
That
what.
is
So
not
we will
problem.
take a printout. So the field team will have this chart with them with an expected date, and they will add that the status and the actual date.
Anyway, like this seeds need to be prepared for only the means recruited cases only. So
That's
you
what
can
I'm saying.
just generate
Once
it.
they are recruited,
Yeah, from the date of enrollment, the day we will do the baseline survey, you will automatically calculate because it will open every 7 day. So it will be automatically calculated and you can get a printed copy of that. Yeah. This form for each and every participant, but look, one form is for one participant only. Yeah.
So one question I am having, we have enrolled a participant on say 10th April and the blood is collected on 11th.
So it will be from 11th.
11th.
Yeah.
And entire follow-up will be from 11th.
Even like in the system, we have put the ops, like we have not given this that facility. So you have to screen the patient on the day when you collect the sample. Okay, so you cannot screen the participant before you collecting, like a
So
sample is collected.
we have consented the family on 10th April. ठीक है, the दो चार लोग थे उस घर में. We have enrolled two person we could not enroll due to मतलब sample नहीं collect कर पाए कुछ भी reason. तो next day we have follow up the participant and get the sample. So they will be enrolled on next day.
I think best way will be like you recruit if you are recruiting more than one person in a household, it's best to recruit on same day.
Exactly.
Okay, same day आप करिएगा, भले आप next day जाके करिए, क्योंकि because the reason will be you have to make the weekly visits, so it will be better you go on same day. Otherwise, for 2% you are going on one day, and for 2% you are going on another day.
So we have to start our registration only when we have collected the sample.
The
That is what
registration
you're
will be there. You have registered because it will be populated into the EDC. Okay, so exactly. So because if consent is given and sample is not collected, that case will be excluded. Even that also is there. So is once the screening is completed, so you have to screen the. Okay.
Without sample, the participant will not be.
So the sample, the day when we have collected the sample will be the start, will the enrollment date of that
Exactly.
participant.
So, and you have to screen the participant on that day only.
Okay.
So don't delay on that. Otherwise, the follow-up is scheduled from the next day. So you have collected sample today, and you need to screen today, and immediately the follow-up will be scheduled for the next week.
ठीक है.
Okay.
Hello.
Next page.
Yeah. Says next page, the hospitalization reporting. So hospitalization reporting is the similar way, like event ID, hospital registration ID, date of hospitalization, date of discharge, and document collected. Or basically, we can replace it with the discharge summary collected. Discharge summary oblique death summary collected. So it will be same, like hospital event ID will be generated on this format, and the hospital ID HUID will be generated from the system. Sir, at least we can track like first hospitalization, second hospitalization, how many hospitalization that participant has. No, sir, that can be excluded. That cannot be more than.
If you want, you can give the ID. That's not wrong.
Yeah. Yeah. Yes, sir. So, any question on this?
And even below that, we can see the date of last visit or last seen. Okay, so we have to mention, and the reason we can mention whether it is end night or whether it is odd migrated or death. Okay, so it will have a complete track of each participant, this log.
So, just to move to the third log, Dr. Hema, if you can help. Third log. Fever tracker. 888. Yeah. Yeah. So this form will help you to track each and every participant. So as Dheeraj was asking, ki suppose if on a given day we find 3 individuals with fever, so we will report those 3 individuals in this form, and immediately we can calculate their next scheduled visits. So that will help us to plan the visits for the each and every individual as acute phase, follow-up phase visit, or a convalescent phase visit. So when to approach that participant for different visits. So this is the plan for that, and definitely the signatures to maintain the accountability of the team. So if there are any questions, the team sitting in the back, RMRC, PIMS, MAMC, Share, Share India. Any questions? CMC. Sir, NI team.
Hello,
Any question?
Dr. Abhishek.
Dr. Alok?
During
Can, can you
Yeah.
hear? Hello.
during weekly follow, if there is any loss to follow up of the patient, is there any place where we can document in this chart, like
Yeah.
permanent out migration or refusal to participate in the study?
Yeah. So there is a one question status.
So
You can
that's-
say
that's then the e log. Should we maintain it in the participant log also?
yeah.
Is there any like
Weekly log, participant log. You have to mention that.
in which place?
Yeah. Miss visit or something.
So in the like participant, you can see the status is there and the date is there. If it is missed out, then you can mention it over
Okay.
there. Okay. And I think
And
Dr.
in
Rahul?
between, if
Yeah.
we because of any travel to some place, we may not be able to follow them up for couple of visits, and then we may follow them back. So that also we can record it.
Yeah, because that will be two visits will be missed now. So
Yes.
that will be mentioned that week 2, week 3 missed, week 4 again contacted.
Okay.
But at least the thing is ki if they are not available at home, so the site should try to establish the contact through telephone. So matlab like in these days it is possible to establish that contact. So the sites can try. It's like we can minimize the dropouts.
Dr.
Dr.
Rahul,
Abhishek.
Alok sir
Hello?
having a question. but
Yeah,
he-
yeah. We
He's
just
not unable to mute himself.
Yeah. Um, uh, what I can say is not PI, but any investigator should sign there because just to keep the accountability that they should know about all these proceedings. That means like sometimes what happen ki we are missing a lot of cases and then suddenly PI says that I am not aware of it and otherwise we would have taken the decision a bit early. So we should maintain that thing ki that investigators should be onboarded for the things.
SID is site ID. SID.
Subject ID. That will be generated through the software. Yeah.
Then hospital ID, which from the hospital we will borrow from the hospital ID, no?
Yeah. Hospital ID will be generated through the hospital registration. Fever ID will be generated through the fever registration, and the individual subject ID will be generated through the individual registration, the first form, CRF1.
But in your area, actually, it's from the rural area specifically, and they are mentioning the registers, and not electronically. So
Yeah.
they are maintaining the prescription sheet, and where there is no ID mentioned over there. So what to do for that?
Sir, if you can just repeat.
Manually, they are maintaining the case record.
Yeah.
So there is no hospital ID. They are mentioning in the prescription, even if and in the records also. So what? to
No,
do?
sir, that's why we have placed this. They have to keep hospital registration as well available. Means like it is not like they can maintain the paper logs and they do not maintain the EDC. Both things has to be maintained simultaneously.
I think he's getting confused with the hospital.
Yeah.
Okay, for the hospital, like we are not going to have a hospital ID something, but like whenever any hospital case is reported, so you have to report into the EDC, and EDC generate a hospital ID that you need to mention into the log sheet. Okay, so it's not a hospital ID we need.
So in the third log, if there are any questions, yeah, please.
If this is going to be a booklet, like the ID will be generated in the field, so like do they have to carry the booklet daily basis up to the field workers?
Uh, Means like these logs to be carried to the field. you're
I'm
asking.
just asking, do these logs?
Yeah, they need to carry because these logs will fulfill the missing links. There are certain things which are not on the EDC and which the field team will require to maintain that sequence. because the first one will give the number of visits they have to make, but whom to make, when to make, that is not there in the first log, the daily diary log. So these will help them ki which patient I have to attend and which patient I have to take the which sample, acute phase or convalescent phase or whatever phase it is. So they have to have these records with them. Otherwise, also what happens ki sometimes people used to carry some diaries or some sheets ki I have to do this work, this work. So we are just trying to make it formalized. It should be properly tracked. Otherwise, they will be carrying small sheets or some diaries ki I have to meet these people, these people, these people. So it should not happen. It should be properly documented in these source documents. And they can easily make that track. Online participants, if there is any question on this. Ma'am, Dr. Nandini has asked one question. Can we make a standard diary for all sites? So, ma'am, just to clarify that uh, these will be the standard diaries for all sites, but definitely we will have multiple sections. One will be the patient wise, and other will be like for the tracking the visits and daily diary type of visits, like daily visit plan for the field team. So we will have multiple components, but definitely the standard diaries will be there for all sites. So just to move for Dr. Hema, the first one. The hospital. The sample log. ठीक है, hospitalization.
Doctor, Disha.
So, like we have the tracker for the fever, similarly, we have the hospitalization tracker. This will help us to means like keep a track of all the hospitalization cases when they are getting discharged, and basically in the document collected, what we want to convey is about the discharge summary as well as the death summary if any hospitalized death occurs. So these all things will be there. You want to add something?
Yeah, nothing.
Or if there are any questions, yeah, yes, sir.
So for each field team, no, let's say we have 5 teams per site. If each team, like, how many papers does each team have to carry? Because it looks like there is this participant log which they have to carry. Then all these log sheets have to be carried by for every.
No, no.
For the participant, I think they need to have.
Sir, they need to carry only two things. The first one, the daily diary, which will give them the field track. The second is the participant form, because they are doing the home visit, so they have to track every visit. That this participant is missed, or we have taken this participant, and whether this participant has reported fever. While for the other three, they can make their own plan for. Yeah.
Because if so, they'll be carrying. I mean, if you say 150 participants per team,
Yes, sir.
and even if you say 30, like at least if you break it up into 5 days in a week, they'll have at least 30 or 40 of these forms to carry.
Yes,
now, each of these forms, they have to carry it actually every week and take it out and fill it up for a period of 1 year, and they will use the same paper.
Yes, sir.
It is, I don't know, I think by the end of it, it'll be in tatters. If you use the same paper again and
Also,
repeat for the period of 1
means
year.
like if they want to keep, means like they can maintain it on the Excel also. But means like how will they fill on a daily basis? But the main crux is that the continuity should not be missed.
Like even we need a signature from coordinator or PIs, even for these cases. Because what happens, even in RFP2, if even for the fever and hospitalization, there was no linkage between the field and the data entered on the EDC, and there were a lot of duplicate entries, and we were not able to identify. So there was no source document, so we were not able to cross-check whether what the exactly number is correct. So these logs, it will help us to maintain the sync between data which has been captured in the field and on the EDC. So that's why we thought this is more important thing, so that we get exactly how many fever cases are there, how many hospitalization cases are there, and it match with the data which is already available in the software. So if there is any duplicate entry or something, then we can remove it out. Otherwise, we will always we get confused, which is correct entry, which is wrong entries. So
I mean, this sort of beats the idea of EDC because we are again maintaining one paper trail for every of these interactions. Now, is it possible that they come back and then enter it and keep it in the office?
Yes, sir.
Yes,
that
sir.
can be
Yes,
done.
sir. That is quite.
The only thing is, I think the fever ID is generated in the like in the field, no? So will they be able to enter it even if they come back to the office?
Sir, they can do, but I think the participant, detail of the participant, that book, that need to be carried to the field, because it will help them out to give the fever ID and all those things which they need to enter into the EDC. So rest can be like they can fill at the end of the day in the office, but for the participant, for the 160 pages, they have to carry. I will recommend. But it's up
Have
to
you tried this paper-based tracking system in the field? Here.
I think
Because
yeah,
we are not
did.
questioning the purpose. Purpose is
We
is
tried
good.
we tried with a one WHO study which was multi-country study. So we have some log. We prepare some log, and that they were it was hospital-based study. So and then whatever they were entering into EDC, because we have to remove the identifiers and all those things. So we have a log so that which was linking EDC with the source document. Okay. So we kept that log, and then when we went for the the visit, for the QC visit, and when we crossed it, there were a lot of gap. Okay, between the hospital document
What was
and
the duration for which this paper-based log was intact? That's the question.
So
we are not questioning the purpose. We are questioning the medium that is being used, like to carry this paper every day, handling it at least once a week. Will this one single paper will remain intact for a year? That's the question. Very simple.
I think we can bind up we have some binding type of thing. We can bind that seat and keep it like a
Yeah,
book.
we can make it as a booklet instead
booklet.
of paper. We
Yeah.
can make it as a booklet.
It can be used. I think we can for the field we can give them the bag and everything we can provide them. So it's like for our purpose. We need this document.
And none of the data is going to be entered onto any platform. No? I mean, all this data is only captured so that in case you have a problem with this thing, this is to counter check what is there in the EDC.
Like this will be the source document.
Yeah.
Okay, and we will cross check with the data which has been entered.
Yeah.
So we can have a QC type of thing with these documents.
This is not entered onto any platform
no,
or computer or
no,
anything.
no.
This is actually a source document.
No, this will be not entered into EDC. But whenever we will come and we can cross check with the data which has been uploaded and the source document which is available. And same way, it at a site level also, like when they get these log state, data manager or coordinator can cross check data which has been uploaded on the server. If any data is missing or something, then they can contact me, or if there is any problem on that while uploading the data.
Just one input, in case there are paper-based logs required, and these are required for longer duration. So one option is also for research, we use a better GSM paper, like 120 GSM or something. That is still, has a longer life and can be maintained in a better, because it's little thicker. Usually what we use in regular practice is a 40 GSM. So that increases the life of the paper as well.
Yeah, main will be the participant link, participant log. Other for the fever and hospital, they will be if you go by cluster wise, I don't think they will be more than 100. How many cases? 100 per cluster. There will be 100 fever cases, might be. And for the hospitalization, I think they will be 50, maximum 50. So once it is
But for every participant, you'll have to take the log. No, I mean, for every participant, it doesn't matter whether they have fever or not. like when the field team goes to the house, they actually have to take all these logs and go with them.
Only the participant log they need to carry.
Yeah.
Okay.
So I mean, the concern is that like you use the same paper because there is no. I mean, what we will tend to do finally is to actually have a backup of this in the like a duplicate backup in our office, because I don't think this will because let's say one goes missing in the community, then it's gone. I mean, so. Like anyway, that's what we will probably end up doing. That we'll have a
Sir,
backup. Of
means
this.
like we can just figure it out, like what to do. But these logs to be maintained in order to capture the missing links. The whole purpose is that because the flow will be missed. So we can decide whether to maintain it at the office level or at the field level. But preferred will be that if they carry into the field, sir.
So, Dr. Abhishek, so in that case, are we keeping any record with the present participant? Will there be any record with the participant?
No, no record will be given to the participant.
So
only the POC reports will be given, and a duplicate copy of that report will be kept at the site.
So
participant does not need to maintain any record, though there was suggestion about a diary to be maintained by the participant, but we haven't figured it out yet. But the site can suggest over that if they are ready to have that.
I think it would be better if we can give them a kind of a health diary system.
I think Abhishek.
So there is some participant diary, and I request if CDSA can just give a idea about it. Yes, sir, you were asking something.
Hello. Excuse me.
Yeah, Dr. Abhishek. So there's a fever ID card which is being prepared, and with the help of SAS, it was finalized. So I think we can discuss that tomorrow with all the PIs and the co-PIs. And if any further suggestions are there, we can discuss.
So,
further.
Dr. Kumal, is it possible to display that card and share with all of us on 13th morning?
Sure.
Because tomorrow we all will be in the
Definitely. Once,
but definitely on Thursday.
Yeah, I think it'll be a good idea once we get the inputs tomorrow. We can share the logs and forms once again on 13th.
Okay. So
One
I think
query.
that will answer your question, sir. Dr. Palos.
Dr. Abhishek.
Yeah. Yes, ma'am.
Can we have this participant log sheet generated in the tab? Okay, it may be from
yes,
our
ma'am.
site or from the EDC, and then they can come back and fill it up in the hard copy. Can we do that?
Ma'am, that Neeraj can answer. The ma'am is saying, can we have it on tab? This sheet. All logs on the tab.
You can maintain it in Excel also, but I will prefer to make it in paper. That will be more convenient.
My question is, we'll make a Excel of it, and can we put it in the tab? That's the question. From our site.
Excel sheet can run in the tab.
It can run, but I don't know how
how much it is
signature and everything, how it will be
No,
done.
like after coming back like to the office, they can fill it in the paper can be filled in the office seeing from the Excel sheet. So that
they need not carry
this except the participant list, the other things they need not carry always. That will save this for long time.
They're suggesting we can use the electronic media for capturing all that information.
Like if
No,
we
the
go by
purpose-
the 150 ohm, कितना मोटा होगा इतना ही सा जरा सा फाइल है फिर एक्सेल में गलतियां ज्यादा होंगी ना छोटा स्क्रीन है ना दैट वाई वो एक्सेल में मेंटेन करे कहीं गलती करे दैट्स द प्रॉब्लम वो पूरा पेपर दिख नहीं रहा ना दे कैन नॉट विजुअलाइज इट थोड़ा सा लैपटॉप होता है लैपटॉप में एक बार सब
Sir, one quick question.
Okay. Yeah.
So you are saying that this manual log is for quality checking. Yes.
Which one, sir?
This manual logs.
Sir, this is not only for the quality, also to maintain the track of every activity.
Okay.
Because this time we haven't built the
So
so many processes.
which one you will rely? Suppose there is a difference between in the EDC and this one.
This one will work because it will be verified by the investigators also.
And
So
also, have you
definitely.
calculated of searching time among 150 participants on the book? If you are in those steps of the participant, if you are searching for that particular study ID to enter the data, then what is the time?
Sir, if you can just repeat.
I'm saying that if you are saying that you have to carry this booklet, so for the particular participant, you have to search for the page, right? So what is the time estimated if you are in front of a participant?
Sir, like we will be targeting some 20-30 individuals a day. So we can easily find out those
But
individuals.
still we have to search manually in the booklet. You're not getting me.
So that will be arranged as per the census IDs, no? Because we are using the line listing IDs. So that can be arranged in that way, and we can easily track them. Means like they are arranged in a proper serial number.
So this is not for the quality, but it's for tracking.
Yes, sir.
Okay.
Basically,
just
sir,
now,
it will ensure that everything is done in a proper
So
step-wise
all
way.
it is maintained manually for tracking.
Yeah.
So all 40%. Thank you.
Dr. Abhishek, somehow this idea is still not very palatable of carrying these, these many papers every day in the field. And if this tracking has to be done through this paper-based medium, then it also raises the question of the, why we are doing this ADC at all if it is not able to provide us this tracking. So I think it will be good that if you just rethink about this particular issue. There are a couple of practical things here. The way the sir was asking about the time taken by the field workers to really search for that particular participant ID in front of the home. So these are all practical challenges apart from the paper itself.
Yeah.
So if you can rethink around it, your idea and the purpose of this documentation is perfect. But the medium, the way we are trying to think at this moment, which is paper based, is something. Please rethink about
Sir,
it.
like I'm fine with that. Like, but the main problem is there is no linkage between the field, what they have entered, and what data is there. You can generate any report. Okay, this log sheet will be generated everything. If you have to verify this, whatever data is on the server is matching with the data which has been actually collected from the field, how you will do that? Okay, if for example, in EDC, the report is generated, we have like the 50 fever cases. Is there any source that whether if there is any duplicate data or not, so that we can link that component? If there is any duplicate entries, wrong entries, there are some extra fever cases reported on. There are a lot of error which has, like most of the time field worker do. They enter the fever case twice, thrice, or something that time, and at our system it's showing like 60 cases, but actually it is 60.
Understand. I understand. The thing is, normally, I mean, in the previous studies, so there are a couple of questions that are genuine. Whether the person has really visited, number one. Second thing, that person has really inquired for the fever, and if fever is there, that has been documented or entered. So how we are going to be confident about it? A fair level of confidence when the everything is happening in the field. There are QC procedures on site where there are QC checks which are done. Perhaps Shailendra can explain that.
In our earlier studies, we have a fixed percentage of weekly home visits and fever visits that has been allocated to supervisor, just as we have done in Sumarth 1 also. So similarly, we were doing that 2 to 3% of weekly fever of all the field worker to the supervisor, and similarly fevers also. So this is the way we were doing quality check on daily basis.
Sir, it's okay. I understand, like for a SAS, I'm okay. But it's like a process for each and every site. Okay, if you like I can't say, but it's process where you can do your best. Okay, but we need some evidence, and everything should be for common for the east side.
So the question is, these logs are also filled by the field worker only.
Agreed.
The EDC is filled by the field worker. He will fill in the EDC and then he will enter it in. So
Sometimes we have in our past history, they said that they have entered 5 fever cases, but they were not into the EDC. Okay, and they have sometimes said that we have entered 10 cases and EDC there are 12 cases. So there should be something what they have written should be actually into the EDC platform.
so it has to be
Okay.
checked daily.
Yeah. So you have the receipt, the report can, we will generate a report from the EDC. You have a report on EDC and you cross check with your field team whether it is matching or not.
Sir, the EDC will be filled on the field itself, right? EDC format. This is filled at the end of the day.
Yeah.
Then which will be the reliable? Because if there is any error mistakes, it might happen in this, but not in the EDC tablet, right?
No, these are the basically the logs, video, whatever you have done, like your report.
This is for follow up. That's it, not for the quality checking.
Whenever some technical glitches happen, this will always help. I don't think it will be a problem maintaining this log. We can otherwise enter it in a Excel as somebody suggested. We can have it in Excel and come back and make it as a hard copy.
Yeah, even so, like at the field level, we have different level hierarchy also. So like the data is entered by the field staff and it go directly to the server. And there is no linkage between the supervisor, how many cases you have entered. There is no linkage. Okay, the supervisor can cross check or give me your report, like how many cases you reported. He can contact the data manager. He can cross check whether they have entered or not. They can even go to the participant also for the tracking also, that whether there is fever reported or not, or they can cross check with that sheet also. It will help them out during the data collection for the super quality control. Yes, sir.
So can I suggest that you have a fever tracker form, no? That has got almost all the information that you need to fill up onto the that individual's participant log. So can the field team just take only the tracker, and because that tracker has all the information. I mean, that has FUID, whether it's acute phase, follow-up phase, date, everything is there. So there'll be, I mean, like maybe at the beginning of the day, that can be generated for a particular field team, and they just fill it up on that, and the individual log is maintained at the office, and that is filled at the end of the day when they finish and come.
Okay, so you're talking about the fever log for the fever tracker generated by the system.
No. The physical log, which you have on fever tracker form, no?
Okay, so for the participant, we have kept the fever episode to give the fever episode ID. Okay, so if suppose there is a fever reported, so which episode it is, so that's why we link the participant with that fever tracker. Okay, so that we can assign the episode ID. We can remove the other questions from the participant, that the date and everything, whether it is completed. We can keep the UID and the fever episode ID, and rest will be in the fever tracker. That we can do. Okay, so
yeah, so because this is the form, I mean, all the information that is required is
there.
captured in this.
So in the participant log, we can have only the fever UID and the episode ID. Rest we can remove. So that can be.
One more
Neeraj.
doubt I had. This screening status is there, right? Here in this fever tracker. Pass and fail. That one, like we can't fill it on the day of visit. Sometimes there can be fever day 1 on the time of weekly visit. So we have to wait for a period of
you can
2
wait.
days
Yeah.
to see if it's really continuing.
We need to wait for 2 days to get that result. So now to the sample form, Dr. Hema. So as I told early, like this will be a tracker, like how the sample is coming and how this flow will be maintained. Like from the one cluster, how much amount of the sample is coming, date of sample receiving, time of sample receiving, and then the date and time of centrifuge, and followed by the number of aliquots formed. So that will help us to track the samples, like how it is coming and how it is maintained. So this will be the sample, and this log will be separate for each vial which we are receiving. So for the baseline, the plain vial, and the acute phase, plain and EDTA vial, convalescent phase, follow-up phase, and all other phases. नहीं ये lab में. It has to be maintained at the lab. Field वाले तो हो गए.
जिसमें बारकोड भी प्रिंट होगा ना जब भी सैंपल कलेक्ट होगा
वो भी बनानी है.
ओके
Okay, so this will be the sample log which has to be maintained at the site lab, and we have the other 3 logs for each phase. So I will take you through one phase only.
What is the purpose of cluster in sample log and aliquoting log?
Uh, for the cluster, it's only about the receiving, that we from the sample, from the ID barcode which we will have, the sample ID will automatically also tell us about the cluster.
Because this documentation will happen again on papers, right?
Yeah.
Correct. So as far as cluster is concerned, cluster number is concerned, it is not required by the lab, and I don't see any purpose also of having that here.
Yeah, so that can,
Because this log will be filled in the lab itself
Yeah.
once the sample has been received.
Yeah.
As far as the sample tracking is concerned,
Yeah.
that is completely dependent upon the participant ID, that is in the form of barcode
Yeah.
generated at the time
So,
of collection, right?
That's why we create the subject ID
So
itself.
better to remove that.
Cluster can be removed, but sample ID will be there, the one which we will get from the barcode.
Sample ID is the only kind
that
of
will suffice, I think.
that is sufficient. And as far as this aliquot 1, 2, 3, 4 are concerned,
Yeah.
so on the aliquot itself, are we defining the number? I mean, what we are going to exactly label them as? Aliquot 1, 2, 3, 4.
Yeah, so that barcode number, so we will share, that will be discussed. But basically, that will give us the number. The aliquot 1 will be developed from this sample ID. So it will definitely show that for this participant, the aliquot
These
1 is
details will be
developed.
discussed tomorrow. How the labeling will
it
happen?
will be on 13th.
Okay, fine.
So we have
Fine,
like
And also we will show
I'm
the
sure, I'm
barcodes tomorrow in the lab, in the field itself.
Normally, we just incorporate another digit to show that it's aliquot of this particular.
So I think
Okay, fine.
that will give the clear picture regarding the barcodes.
That's
Like 10 to 12 characters scheme where it will be self-evident that which site it belongs to, which round, what is the sample participant ID, and then is it a serum sample or EDTA sample, and then aliquot 1, 2, 3, and even fever episode number. That's what I think you were proposing.
yeah, even we can discuss this log on the
F1,
lab
F2 like that.
presentation after.
Tomorrow also we will discuss along with the lab presentation.
Okay.
But just to give you a brief about this.
Agree.
Yeah. And similarly, if we see the aliquot acute phase aliquot log, so this is just to keep like which aliquot is placed where, just to keep a track of that. Like the aliquot 1 is developed, so the date of formation, the location, and the box ID. The location will include, like for example, in a box there is A3. So we can say in this box this sample is placed at A3, A4. There are like 10 by 10 boxes are there. So in that way, and the box ID we will place one barcode over the boxes, because we will make sure that boxes are sent to the site or to the labs. So that ID will come, and only the date of transportation and date of result. So that will help us to keep a track of that. And similarly, the other 2 forms are there for convalescent and follow-up phase. मतलब EDC start करते हैं, क्योंकि या तो स्टार्ट कर देते हैं या फिर हम चाय के बाद स्टार्ट.
Dr. Abhishek,
Yeah.
Yeah. Under document collected, we have to list all the documents whichever we have collected from the hospital. Like we have to list all those things.
Yeah.
And also we have to take Xerox.
No, in the document collected in which page you are talking about?
Hospitalization tracker.
This is regarding the hospital documents, discharge summary or death summary. Because
That's it.
there are two outcomes for which you will need the documents. So it could be discharge summary or death summary. So that document you will just mention that this document has been collected from that individual. Because for the hospitalization, if we are not having the acute follow-up or convalescent phase, so discharge summary will only give us the final answer. What could be the possible reason for admission? Yeah. So I think we are done with the logs, and we'll just see if Dr. Rahul, should we
excuse me,
break
sir.
for tea is ready. So can we break for tea? Because we just need to start the
excuse me,
EDC.
अभिषेक
So
सर, अभिषेक सर, एक स्मॉल डाउट है.
Yeah.
ये एक्यूट फेस अलिक्वेट लॉग में ए
Yeah.
सैंपल आईडी बी सैंपल आईडी बोल के दिए, उसका मतलब क्या है?
Which one?
एक्यूट फेस अलिक्वेट लॉग शीट में.
Yeah.
वो ए सैंपल बोल के दिए ना, फिर बाद में बी
No,
सैंपल
no,
आईडी.
no. I just put it as a A, B, C, D, like different samples are there.
Okay.
This is just a numbering.
Okay.
It means like it is not specifying anything.
फिर
For
एक्यूट फेस
example,
में
if we
5
have
सैंपल
taken the
है.
first sample,
Okay.
so we have make 4 aliquots. So the first the idea about that sample, like the ID of that sample, and later on below that the alicot ID.
ठीक है, थोड़ा कंफ्यूज है सर. ये एक देखिए, फिर बाद में
नहीं, वो I will remove that A.
Okay.
Not a problem.
फिर EDTA सैंपल भी आना है इसमें.
Yeah.
वो भी नहीं आया.
No, I have one question. It may not be really related to this law. I mean, I don't know whether maybe Dr. Meenakshi can answer this. So when we take a sample, let's say you bring in one sample for in the with fever, and you spin it down and then alicot it and put it into a particular freezer box. Now, we might only get 2 or 3 samples a day. Now, the next time we bring another sample, we will have to take out that
So
and then
right,
put it.
right.
Will
So
that count?
so-
Like, will it be like a freeze thaw or?
No, it will not be freeze thaw. I mean, we had discussed that last time also. So we kind of, mimic that position. So know that which box ID is being used. In this study, we had also suggested we can use a lesser number also. 10 by 10 is an ideal one, but you could go for a lesser also. You just know that which position you have filled it up. And so in the current one also, we are doing like that only. You start from the say, I think this was Dr. Rahul's brilliant idea that time, and he had suggested that wherever you have come till what point you have done, just start from the same position and then place it there, transfer. Because it doesn't thaw in immediate retrieval.
Okay, so
you
even
just
if you take
transfer
it-
through the rack only.
Okay.
But I think the only discussion we can have maybe tomorrow or just like more from with the lab people who have to practically do it, how feasible and comfortable are with the logs and whether they want to change it any format and columns in the way they are doing it. I mean, is it okay to have a subject wise you would want or a day wise, or how do you want to track it? That's more important. Because it's a paper based, so they'll have to link it somehow with the subject also.
Maybe
The
once,
IDs are
once
there.
we have this
That will help.
lab,
So there would
lab
be there would be primarily one is the ID on the barcode ID on the primary sample, then on the aliquots, and then on the box, cryo box that will be there, and you can differentiate through the aliquot number, AQ1, AQ2, like that. The way we are doing it already, similar to that, I think we're proposing tomorrow also. So we'll take your inputs also, whether they are.
normally actually depending I think we will discuss this in more detail in lab session rather than spending
Yeah.
time more other people's time on this and technical practical details.
So now we can break for tea first, and then we can start working on EDC. So we will meet we can start next session. Yeah, 10 minutes after 10 minutes. So 350 is fine. 350. We can start our section from 350.
I mean, it will stay in the tray. At the end of the day, you can transfer. So I have a doubt. The process will be different for A1, A2, A3, right?
Skip pattern, range checks are also there. So, and even it also give the automated workflow also that the system will automatically like tell like what's the next is for the screening and eligibility. All things are there. So, so in the app we have only the security feature is automatically get log out if it is not used. And once the data is uploaded on the server, the study data is removed from the tablets. Okay, so like how to install the Sumat app? You can go to the Google Play Store and you can search for Sumat 3 app, and then you will see the Sumat app and you can install it. Okay, so like once you download the install the Sumat app, and first thing you will have to allow the all the permission to the app. Then you can scan. So we will provide the like barcode or QR code. So that will link the the server with the app, and from that we will provide the username password for the each sites, and using that username password you can log into the app. Okay, so before logging into the app, so first thing you can also check the internet connectivity. So for that, you will have to go to the status. When you will click on the login, there will be a pop-up will be appear. So you have to click on the OK, and you can test the speed. So there are different type of status. So we have a excellent, good, moderate, poor, or very poor. If the speed is like poor, is coming poor or very poor, then we recommend not to log in into the system. Otherwise, the form will not get downloaded on the app. Okay, so after the successful login, you will come to the home screen in which you can see the status and the project menu. Okay. So in this screen, you can see the column. Okay, so this is the list of all the forms which are in the EDC, and the name and other is the number of the count which are pending for sync. Okay, if suppose the data is collected and is it in the tablets, and then you will see the numbers. If there is any number like other than 0, suppose, then these forms are pending for upload. So if it is anything is like pending, then you can click on the sync data and upload the data. Once the data is uploaded, this number will like become 0. Okay, so to so after the dashboard, so for the data collection, so we have divided the screen into the data collection and the follow-up. So for the baseline survey, fever reporting, hospitalization, death reporting, and endline zero survey. So you have to go into the data collection tab, and for the baseline, for the weekly visit, home visit, you have to go on the follow-up tab. Okay, so yeah.
Follow-up tab, what is mean by baseline survey?
See, actually, there is a functionality that it's a common software. So in the follow-up, the name will be same. Okay, the baseline survey, like the first, if you see this like data collection tab, So baseline survey, the name will be same. And these even this tab will be also appear over here, but we are not going to use it.
Okay.
Okay, the name will be same. So we have generated a weekly visit on the for the zero survey. Okay. So if you go to the next thing, you can see here. So here I have already mentioned it. So here you can see for the data collection, you have to work on all these tabs. But for the follow-up, you have to only work on the weekly visit thing. Other, I have made it crossed. Okay. So for the zero survey, how we will go? So we will go to the data collection. Then first for the baseline zero survey, we have to click here. So here you will see the list. Okay, list of all the participant which will be uploaded into the system. So you will see the list, and there are different tab over here. You can see the pending, completed. There is a follow-up also, but you are not going to use this tab over here. Okay. So an ineligible case. So for in the case, if any case is screen failure, then it will go into the ineligible tab. And if all the forms are completed, the case participant will move to the completed part. Okay, so after that, once you will click on the fill button, you will have to do the screening part. So this is the overall flow of the screening process. So first thing, based on we will start, we will have a list of all the participant, and we will have to track that participant. So first thing, we will go to the house. We will try to find whether the participant is available, or it's migrated, or is maybe participated dead. So from there we can exclude that individual. And then next step will be we will ask for the consent, and if the consent is signed, then we will go for the we will ask for the other questions which are inclusion exclusion questions. If it is refused, then it will be excluded from the screening. So next question will be stay in the study area for the duration of the study. If he is going to stay, then we will have a next question, age below 2 years. And if it is eligible, then we will have asked for the whether the participant have fever. If he has fever, that will be excluded. If don't have fever, then we will have go to the sample collection session. So in the screening, we will itself ask for the whether the sample has been collected or not. If sample is not collected, then the case will be excluded from the study. So here, so how you this is the screenshot how the you will do the screening part, and once the screening is done, like this is the example for like if there is the case is ineligible, you will get the get the prompt that this case is ineligible, and this case will then move to the ineligible case. And these are the CRFs for the baseline which you need to fill. Okay, so here are a few things like if the form is pending, then the status will be pending, and once it is completed, it will mark as completed. So we can now work on the tablet for the baseline workup. Okay, so we can start with the tablet first. Okay. If you have any question, then I can answer, then we can go with the tablet work. So basically, I will also request my team to go to the work with the participant on the sites together.
So
Yeah,
you
yeah.
said that after data synchronization, the data got be deleted. After data synchronizing to the cloud.
Yeah, okay. So for the study, data will be deleted, but the listing will be there available.
Okay, the registration will be remains here.
Will be there, but for the all these form, you can see these are the form screening form and the study form, this generic form, like all this area of data will be removed from the tablet, but the listing will be there always.
Okay.
Okay. Dr. Abhishek, we can start for the data entry part. So if you can guide them how to do the entry. Yeah, we can. For the online participant, I think we are going to work on the EDC part. So I think if we
So we can start with the CRF. So for the individual registration, the first form you will see. If I start with one of the sites, yeah. So this is the cluster. If you can just enter in the cluster, incline cluster. These all are dummy, na? So you can just put it incline cluster. Yeah. So put it. Yeah. Okla. Because later on we will add the site specific details. This is
Neeraj?
just
Hello,
presently
yeah.
we are-
We started entering it. Here, the question number 5, number of members selected in the
Yeah, you can
household.
just start.
Like if we enter 5 members or 4, it's popping up an alert saying that
yeah,
it should be
so
only 1 to
so
2.
previously we decided we will have a maximum participant from the household will be 2. So that's why it's not allowing.
Presently you keep it 2 and move ahead.
Yeah.
But this clause will be removed. Yeah.
Okay. So first thing, like you can just simply register it, but that part will be like already filled. Okay, when you give me the data, it will be already be like
This will be as
on
per
that
the
pending
data you have
screen.
shared
So
with
you would
us.
simply go to the screen fill
The
screening.
baseline data and other data you have shared, na? Yeah, Dr. Manoj and ma'am knows. So
So
that data. So it will
first,
autofill.
yeah.
So abhi aap kuch bhi, you can write anything in this, but once we will means like that data will automatically fill all this information
The first thing is first we
based
will
on your
register.
census data.
So first we will register one case. Okay, so do the registration work first, then we will go for the screening.
Dr. Neeraj,
Yeah.
in the live phase when we will doing in the field, this section we won't be filling it again. It will be auto-populated from the list we have provided.
Yeah. It will be auto-filled.
It's just for
That's
the
what I'm
practice
saying.
and the new members which are added with the family in the last 6 months.
That
For
can
those,
be added.
yeah.
So like all the data which you will give, it will
At
be there.
present, you can put it like that, but that clause will be removed. That validation check. So we can remove that. तुमने देख लिया?
Yes.
Sir, in the new registration, after the date of birth, like the age categorization is coming now, so can it not be automated?
Actually, that you have to give us. Okay, that data will be already uploaded on the server.
Yeah, sir,
Okay.
but if we are enrolling a new household, means if it's going to be automated, it'll be better, no, sir? Like enumeration data, we'll be giving it to you and you'll be uploading. If we are enrolling a new individual, at that time, like we'll be entering the date of birth and then it'll be asking us another question, like what's the age category, like that it's going to ask. So I'm just asking if can it
See,
be
that will
automated?
be that you have to take the decision in which age group it is going to lie. So you will have to select it, right? So that's why.
लेकिन उसके बिना हमें
नीरज जी,
दिखेगा कैसे?
नीरज जी,
क्योंकि आप
Pre-filled आएगा ना
ID wise
पूरा
कुछ
registration.
दिक्कत ना हो जाए.
excuse.
ट्रिकी हो जाएगा.
नहीं अभी नहीं आ रहा, अभी blank आएगा. Yes, yes.
Sir, regarding this date of birth entry, we have to select, suppose if the person is born in 1956. So we have to go to 1956, it's taking a lot of time. It is not editable, the text, so that directly they can enter the date of birth?
For the date, that is an Android thing. It's not.
Okay.
So you can increase the size of screen, like the font size.
Third gender also is there. Before it was.
हाँ वो डेटा के लिए हाँ अल्फान्यूमेरिक है.
Dr. Neeraj,
Yes, sir.
so is this final? I mean, can this be tweaked now or you can't do anything to this now?
Sir, what do you want?
So like what Jovin had asked, in the second question, no, it actually says age category. Even if you put the wrong age category,
Yeah, it will take.
that's what it takes.
That is
So there's no logic check or anything like that.
No. That we ask for the we ask the sites to give me the data so that it will be help the field worker to identify from which age group this person belong to.
No, if you give the date of birth, you should be able to generate which age
I
group
can,
it belongs to.
yeah,
no?
I can generate the age, but I cannot automate that from for which age group it belongs to.
Huh?
Yeah. So you exactly. So usually in the COVID study, we have planned from some date. Suppose it was 1st of February. Based on that, we have identified all the age group, and then we have approached that population for the COVID study. So age was calculated based on certain. We can take a 1st of May, and we calculate the age of that participant. And because like maybe if we are going to start the data from 1st of May, so we calculate the age, and according to that, we have to assign the age group.
Enumeration data is there, it is auto-populated, sir.
So that is like we previously there was no option to add new participant. Okay, so that's also this is a generic software we use in every study. Okay, so there are some we cannot fully automate the system. The age group we were expecting this data will come from the site, and there will be no addition of new member, and we are not going to add even. Okay.
Like in this one, when you enter the address, you just enter the door number. It's showing, are you sure you want to submit? Like that, any question can be added. Like any are you sure?
Yeah, that we cannot add anything. If we can do, but not now. If we will go for the development, then it will take more time. Okay, so we can do everything, but it will take time for us.
Neeraj?
हाँ जी हाँ 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 ये हाउस होल्ड आईडी हाँ हाउस होल्ड आईडी ये इंडिविजुअल आईडी नहीं होता जो 9 डिजिट वाला वो जैसा आप दोगे जो हाँ बस वैसे ही जुड़ सका एक मिनट जस्ट हाँ exactly yeah exactly it will happen. Okay, so that time we have again going to ask into the screening form. We are going to confirm. Exactly. Okay, so then you have to take the decision. Okay, at the time of screening, when you have a evidence of, the like date of birth, maybe Aadhaar card or PAN card or something, that will be the correct, and you have to keep that.
I put Kaspa.
Exactly, the age will be calculated based on that only.
So how will
So
you verify
eligibility
the
be.
contact
Hmm.
Rajesh, how do you verify the
हाँ
contact
सर
number
वो
before
भी
you
तभी
add
कह रहा हूँ ना कि आप लोग आइए ना मैं अकेले नहीं हैंडल कर पाऊंगा
that? You have to call.
Yeah.
Before you didn't do that. For the previous phase, you did.
Yes, sir. Okay.
They'll not share OTPs, sir, because everybody are telling don't share with OTPs with other people. Or they'll blame him if something happens.
Okay. Yeah.
This comfortable time is
Nee, at least if you have to, this is only for the cancel. Okay. If you have to go back, yeah.
comfortable time.
So for the new feature, currently we cannot go for the new feature. If it delay, nee, even though you are not going to fill this will be all auto-filled. Okay. So nee, if we have to go for the new feature, then what will happen that I have to give this application for the development, and we don't have that time. Okay. If we have any issue in the forms, then we can work it out. Okay.
Julian is giving an idea. What is telling if there is a column so that age you can make.
Yes, tell me.
We are going to put the age within which category the field worker can easily make it out.
हाँ तो ले लीजिए ना क्या दिक्कत है वो तो आप खुद दोगे ना उसमें मैं थोड़ी लिमिट लगा सकता हूँ
There is a pop-up coming out telling this the age of the participant.
तो आप डेटा दोगे ना 2 years का मैं तो ये डेटा पहले जो आप दे रहोगे वही अपलोडेड होगा नहीं ऐड कर सकते नहीं कर सकते आप। नहीं वो मना कर दिया ना कि we cannot add new person. Whatever data you have in census, you have to use that one. Otherwise, you will have to add the मतलब means you, if there is new household, then you will have to add new household. नहीं ऑप्शन है, but we will not go with that. Otherwise, वो confusion create करेगा ना, फिर new household भी add करो. नहीं जो लिस्टिंग है ऑलरेडी उसी में वो जाए ना, फिर अब क्यों? नहीं हम नहीं जाते वो क्या, अगर हमें उस पे जाना है अपने अपने पास जो लिस्टिंग है, लाइन लिस्टिंग, उसके अकॉर्डिंग जाना है, देन यू गो विद दैट ओनली ना. उनको क्यों ऑप्शन दे रहे हो? कंफ्यूजन क्रिएट होगा. अच्छा आपका पुराना है आपका? हाँ तो फिर अपनी चिंता करो, ठीक है. हाँ हाँ you can talk to him. नहीं तो मैंने कब कहा है कि डेटा वो दो, जो आपने फॉर्म दिया मैंने बना दिया है, अगर नहीं चाहिए तो हटा दो नाम, मुझे कोई दिक्कत नहीं. मैंने WHO में तो सब नहीं, वो तो फिर फील्ड वर्कर को प्रॉब्लम होगी ना, फील्ड वर्कर को प्रॉब्लम होगी. मैं तो फोन के अगेंस्ट था, फोन के अगेंस्ट था. नहीं वो उस तरह का काम किया गया है, वो भी इसमें भी कर सकते थे, ठीक है, लेकिन क्योंकि कोविड में हमने ऐसे ही किया था ना, तो दैट्स व्हाई इट्स कंटिन्यूड. बंद हो जाएगा. हेलो, अरे वो अभिषेक से बात कर लो, मुझे नहीं पता इसके बारे में, ठीक है. हाँ अभिषेक से बात कर लो, वो जैसे बताया वैसे कर दो, ठीक है ठीक है ठीक है. हाँ हाँ देखिए एनीवे देखिए बात तो वही है ना, जब मैं गया डिक्रिप्ट भी कर दूंगा, बात तो वही है ना, बात तो वही है. हमारे सिस्टम में रहेगा, मैं जब डिक्रिप्ट कर रहा हूँ तो मैं भी कर सकता हूँ, तो आप इंक्रिप्टेड ही देखोगे. आप भी तो इंक्रिप्टेड ही देखोगे ना. जैसा जैसा दोगे कहीं नहीं है, आप नाम ही मत डालो. Yes. This is a system ID. Okay, this we talk, and this is like temporary. Once the data will be uploaded, then it will get changed. Like that's why we have specified the UID. Just which one? This is for the individual ID which is given in this application, in this software. This is this household ID from the census, and this is the individual ID from the census.
Person unique ID.
Person
unique ID.
ID. This is for the this project. This is the participant ID only ना.
जो हम पार्टिसिपेंट को देंगे,
हाँ
ये वाली नंबर,
ये ना UID जो है ना. देखिए SID यूजली क्या होता है ना, जब डेटा कलेक्शन के लिए आप रिपोर्ट करते हैं ना, उस टाइम पे स्पेसिफाई कर देते हो, तो उससे क्या होता है कि डेटा कलेक्शन करने में इजी होता है. अगर UID देते हो तो UID से पहले मुझे SID निकालना होता है, फिर SID से मैं फिर वो करेक्शन करता हूँ. आप यूज करोगे ये UID यूज करोगे आप UID.
चार मेंबर चारों इंडिविजुअल आईडी देंगे, वो UID देंगे या SID?
UID चेंज हो जाएगा किसी में.
After thinking the SID was made, that is only for the system's purpose to
Make a unit.
how the document is status of the document.
This is offline.
Not asking comfortable time. Database all the questions will
Nine? नहीं 9 to 6 वैसा नहीं है फिर वो क्वेश्चंस होंगे दो क्वेश्चन ऐड हो अरे वो टाइम का हटाना है इसका कोई जरूरत नहीं नहीं मतलब एक ही रहता है ना टाइम पे एक ही बढ़ जाएगा वो फिर क्वेश्चंस होंगे तो
There's no second rate on there.
नहीं वो डेटा पूरा इसमें आ जाएगा आप खाली फिल में जाओगे ये तो अभी डेटा नहीं है ना ये सब प्रीफिल्ड आएगा ये तो आपको खाली व्यू करना होगा जैसे आप जब जाओगे ना तो आप यहाँ से व्यू करके देखोगे ये यहाँ पे ये ऑप्शन ठीक है देखिए सर किसी पे काम करेगा ये स्टार्टिंग सीरीज पे हाँ हाँ आ जाएंगे इसको एक बार चेक कर लेंगे हाँ सर्च होता ही था नहीं इवन जो आप प्रिपेयर करिएगा ना लिस्ट आप जैसे सीक्वेंस में जाएंगे ना उसी सीक्वेंस में दीजिएगा तो उनको एक्सक्लूड कर दीजिएगा उनको क्या अच्छा अब देखो यहाँ नहीं सेल नहीं मैंने उनको बोला था कि कर लो हाँ पता नहीं अब अच्छा मैं देखिए
I'm not submitted there. For like a field or piece, some other thing has happened. Before that, it has been like completely.
Hey, you don't do that. Na? Play with proper way. Na? Like this isn't a game. Okay, you have to fill the form. Okay. Okay. So simple. Go in the straight way. It's not. If you have to go to back, then it will close. No, this is the Android functionality. Na? So you cannot. Okay. So because there is a skip. Okay. Okay, that is the first person.
Mobile number fill பண்ணுங்க.
This is due to skip. Otherwise, I will have to add another question. 1 to 10, like one year, 2 years, 3 years, 15 years.
Screening like registration already there. In screening, will be entering data about asking another.
Yeah. So you have to confirm because the data will be given by you from your sensor, so it may not be correct. So no, in the screening we are asking again date of birth. Okay, because when you give the list, okay, at that time you have the date of birth based on response. Okay, and when you are going to enroll in the study, so you will ask for the evidence, like for the address for for the date of birth proof, Aadhaar card, PAN card. So it will not match. Most of the time it will. So that will be this will be considered a screening one.
So அது வந்து சேம் இண்டிவிஜுவல் நெக்ஸ்ட் கம்பல்சரி ஒருத்தர் ஃபில் பண்ணி
For something you have done like in a
இது எல்லாத்தையும் fill up பண்ணிட்டு next page என்னன்னு பாருங்க.
ஓகே
educational status.
Okay, so in our discipline, we have in our
pressure cooker table electric fan
I know that. Who actually can, and that the problem is with the skip on the first question. That's why it's pressing. Okay, so there is no question before that. So that's why it's pressing. It will happen. So, no, see, the problem is that they have to go in proper way ना ऐसे नहीं खेलेंगे ना अंधी मतलब कुछ भी करेंगे मतलब they have to
pressure
this one will be
golden a big stone அது நான் அசெட் அதென்ன அசெட்
maybe it needs a grinder, I guess, in modern.
ஓகே லக்னா இதுதான வரும் லிங்க் பண்ண அதேதான் bicycle yes motorcycle yes animal drawn car 4-wheeler tractor bro
So here you can enter educational status now, you can enter only numbers. Meaning what, how you enter.
completed number
10th pass, 11th, like that.
it is studying 7th standard now we are going to the 6th completed yes only
If he is in first year or something.
yes
He is doing PG or something.
12 plus 3 plus 1 or 7th discount huh
She is coming.
डाउट तो क्लास में तो पढ़ ना
क्या
वो ट्रेनिंग में मैंने
हमारे इसमें सेंसस में क्या लिखा है
स्क्रीनिंग में जो भी आप प्रोजेक्ट ओरिजिनल डेटा पर एंटर करने वो एंटर करने पर स्क्रीनिंग के साथ प्रोजेक्ट डेट की सिचुएशन आ जाए विद नेम ऑफ
तो वो स्क्रीनिंग में ये बाद में क्या करिएगा उसको आप सर्वर पे जाके एडिट कर दीजिएगा डेट ऑफ बर्थ आप एडिट में जाके वो चेंज कर दीजिएगा नाम भी अलग है नाम भी चेंज है तो हाँ कर रहे हैं जेंडर भी चेंज होगा फिर जेंडर वेंडर भी चेंज किएगा
लाइक उन लोग का डेट के हिसाब से डेट ऑफ बर्थ के हिसाब से बहुत इश्यूज हुआ था लोग बिल में गए तो पता नहीं कोई
yes
चलो ठीक है लेट्स सी ओके so you are trying that so how's thing going you have done the screening also He's gone married but Gona is in villages
document with diagnostic calculation
yeah so in Palwal also same thing is there Like they get married very young and they go back.
What is the importance of that?
But we are not. This is like if you get a response from them. Okay, if they are saying, then we have to capture. So,
जब ऑक्यूपेशन में वो मैंने मेंशन भी किया था लेकिन हमने वहाँ पे डिस्कशन नहीं की है जैसे ऑक्यूपेशन में 3 साल का बच्चा है अगर वो तो स्कूल जाएगा ही नहीं उसमें तो नॉट एप्लीकेबल होना चाहिए तो कोई ऑप्शन नहीं है
स्टूडेंट है मतलब स्कूल नॉट अप्लीकेबल का डाल देंगे इसमें इसमें नॉट अप्लीकेबल कर देंगे नॉट अप्लीकेबल ऐड कर देंगे आप लिख लीजिएगा कंप्लीटेड ईयर जैसे हमने कोविड में भी वही सेम रखा था कंप्लीटेड ईयर पहले मैं सोचा था उसको कैटेगरी में डाल दूं यू कैन रिकमेंड ओके अगर होगा तो मैं ऐड कर दूंगा मुझे उसको प्रॉब्लम नहीं है so you can point it out and like we I also have a category we use in census we have for the education we have degree all degree and everything and that sort of everything yes everything is there so but here in we use in covid so that's why we are using if we want to have maybe we want to combine the data future maybe that's why it's the same way
Yeah. Because occupation is there. Income also is there. So the education will be
exactly
Animal may or may not have a disease. Like for example, no, it may not have illness at all. Animal may be the source of the infection, but the animal may not have disease, may not be sick. So that.
baseline form भर रहा हूँ हाँ हाँ वो तो आपका नहीं कंसर्न में ही है ना कंसर्न में रहेगा ना जब आप इंक्लूजन क्राइटेरिया रखोगे ना कंसर्न के टाइम
जब 500 लोगों का फॉर्म भरना है या जहाँ पर हमारा एज ग्रुप कंप्लीट हो गया
वहीं पे रुके ना
ये नहीं मतलब अगर 250 पे कंप्लीट
नहीं जैसे आप जा रहे हैं सब कुछ आपके रिफ्यूजल हो रहे होंगे कुछ ये हो रहे होंगे आपके जब फाइनल स्टॉप हो उसके बाद वाला जो जितने बचेंगे ना मुझे बता दीजिए मैं डिलीट कर दूंगा सर
So what? No, the date. So what I think we did so I mean, I don't need to.
उससे ऊपर नहीं आएंगे
What we can find out.
If you put others, we don't, there is nothing to write. So this one is there, construction of floor. If it not this way, it's something else. Others ना what others?
मतलब थोड़ा प्लस माइनस 5 चल सकता है
अच्छा वही दिखे मुझे तो जो मैंने पूछा इंक्वायरी की थी उसी जब डॉट पे काम करता हूँ ये वजह के 150 ही ले लेना उससे बियॉन्ड तो नहीं लेने ना रिक्रूटमेंट जो करना है पर क्लस्टर 150 केसेस का ही होगा उससे बियॉन्ड 160 कर सकते हैं कि नहीं कर सकते
सेम वे
क्लस्टर वाइज दैट्स व्हाई क्लस्टर इज सिलेक्टेड ना वो जितना भी होगा उसका टाइमिंग सब सेम ही होंगे मतलब आपके जो भी डेटा सिलेक्शन प्रोसेस होंगे
प्रोटोकॉल में क्लियर नहीं मेंशन है बिकॉज़ हमने यही सोचा है कि साइट का मिला के बट नॉट द
क्लस्टर वाइज ही करना पड़ेगा क्योंकि आपको हर क्लस्टर क्योंकि अलग अलग आपके में ज्यादा डिफरेंस नहीं होगा डिस्टेंस का तो एक ही जगह बसे हुए हैं For the self-reporting, you can fever can be reported by the participant directly and through the weekly home visits. So once any fever is reported, then you will have the field team has to go to the home participant home, and then if fever is identified, then you have to register the fever. Okay, and once the registration is done, so you have to see whether the fever is has means is completed 2 days or it is less than 2 years or 2 days. So if it has completed 2 days, then you have to go and do the screening part. If not, then you have to wait for the 2 days. Okay. So it will check for the criteria, and if criteria is fulfilled, then you will go for the fever workup. So this is the flow for after 48 hours from the date of onset of fever. Research team screen the participant. Okay, if present condition of the participant is dead, then it will be excluded. If it is home or hospitalized, then the next question will be has fever more than 48 hours, uh, 48 hours or 2 days. If no, then it will be excluded. Otherwise, it will ask for if yes, no, but currently taking medicine for fever or unknown due to hospitalization, then it will ask for the highest temperature. And if it is yes or not recorded, then it will go for the a fever follow-up. Otherwise, it will be excluded. So these are the some conditions which we have put on the screening. So for the fever reporting, you will have to go to the fever reporting tab. Then you can go and register it. And next step is to link this fever with the individual with the participant ID. So for that, you will have to tab on the individual option. So here on the input screen, you have to click here. Then you will see the screen will be pop up where you have to select the subject. In the subject, you have to go to the baseline survey weekly. So this is the list of all the participants which has been entered into the baseline. Okay, in data collection part. Okay, so when you will select, you will get the list of all the participants. Here it will show the list of all the cases, whether it is pending or completed. But uh, this is a default option in the EDC. So then you have to select that participant, and where you can also see the SID and UID and the individual ID, household ID, all the details will be available. You will select. Once you will select, then this ID will reflect on the fever registration form. Okay, any question in this screen? This is the main screen. So if there is any error, then it will link with another participant. Okay. So these are the few things in the pending list. After the fever is registered, it shall be get listed in the pending list of the screening. So it is get listed here. So here is the detail about the what we can see on the list. So SID system unique ID will be there, UID will be there. This will be the fever UID. So which you need to put into the log sheets. Okay. So this fever UID will be there. Then this will be the individual ID and date of onset to identify. So it will be listed here. The name is also there, and there is a view option where you can view the detail whatever you have registered. So it will be viewed here. So here we can see only 3 questions, but other question will be visible in the view session. And to fill the form or to fill the screening, you will see the fill. We will click on the fill button. And below you can see what is pending. Is the scanning form pending or the other forms are pending? If scanning is completed, then you will see the generic form are pending. Okay. So after that, this is screening, and if it is eligible, you will see the set of the forms which are listed here. Acute phase forms are there, follow form, and convention forms are listed here. So this form will be open, and you will have to take the decision when you have to fill this form. Okay, so based on the schedule, you will go and collect the data for this form. Okay, this is a thing here. So any question on this? Fever ID. This will be fever ID UID. This UID will be fever ID. Yeah. This fever ID is system generated, and this is participant UID, which we will link by selecting from the Uh, yeah.
So what's in mentioned as UID will be the fever UID that will be mentioned in the log.
Yeah, this UID will be fever registration ID.
And what is in the FEINDID
So
is the individual UID that we do from
This is the
registration.
participant UID. Okay. So any question? Hmm? Name? We need a name of. We need a name so that like research officer go and identify the person also, no? I don't think. Is there any ethical issue for the name of the participant?
With whom? With the
Yeah.
team? With the team?
So Wadu has raised an issue like we are sharing the name of the participants in the individual registration. Remove that, and the individual's name will come as the individual IDs only, but no name will be reflected on the screen. So for other sites, because for Inclin though it will work, but for the other sites, because Wadu has raised that question, because it will be ethically will be a problem. We cannot share the data with the names. So if other sites are also facing the same issues, or how should we approach?
Form?
Not only names, also the address and the contact number.
In which form?
The first one.
Was first one.
The line listing.
So
the one which we have asked for the in a pre-filled form. So in that way, in
So,
that form.
so we are going to recruit more than at least 2 participants from one household.
Yeah.
How are we going to identify which one?
Yeah. So what they are suggesting is through the individual IDs, but we were also not in favor of that. We want the name of that individual because it will be very difficult to identify.
Yeah.
I think Dr. Shika also agree with me.
Yes. So
Even
At the time of screening, we need some.
No. So at the site level, we want all the information. It is needed, but for outside the site, we cannot share the participants' information.
They will populate all the
in
data
the server they are
provide
saying.
from the
So they will
actual
provide the data, but it will have only the individual IDs, and we will have a master list with us, which will have a
the field worker will be matching that
Yes,
UID with
yes,
the,
yes, yes.
the extra paper we will have to be providing them.
Yes.
Even Dheeraj,
Dheeraj,
this
I
is a
think
closed system.
field team can be given access to the names also because they are part of the study. No, so
Definitely,
so
they
this will be used by the field teams.
So we are having concern of sharing the data outside the institute with the
Okay,
other
then in the
collaborators.
server you want to.
This is policy recently, or so like in the COVID study you have already shared.
We have shared, but recently in 2 of the studies, EC has raised this concern for another studies. So that's why we were a little bit concerned about it.
De-identify.
Nahin, matlab that is fine. But if any issues are there, so we just have to see.
Dr. Abhishek, one back here. We still are not very clear about the fever ID. Is it going to be auto-generated or we are supposed to type because it looks like an open-end question? And what will be the
Yeah.
format for it?
No, actually there are two things. One is the fever ID, which will be the patient IDs, like the number of fever episodes. So that we will write FE hyphen 01 or a dash 01.
Okay.
So it will be like FE01, FE02, FE03.
ठीक है,
It will go in that way. The other fever unique ID, which will be generated from the registration form. So what Neeraj was telling, if you can just tell us. I think you were telling about this ID.
Yes, FEINDID
Yeah.
ID. Yes.
So this will be the fever UID. So there are 2 IDs for the fever. One is the event episode ID, and another one is the this one, fever registration ID. So the fever registration ID is this third one, while the fever episode ID is FE01, 02, 03, like that.
There are two suggestions in the comment box, one from Alok and one from Dr. Nandini.
Okay. I think we can see. It is regarding the same thing. It is regarding the same thing. Regarding the names. So they are saying that de-identifiers and initials. So I still open it for the group to decide. But definitely the same thing will be reflected on the tablet. Means like at that point, if the field worker asks, yeah, I want the name of the individual to be reflected, that will be a difficulty. So that is a matlab like a suggestion or a thing. Ki it will be a problem for the field worker because it is quite a problem for us. If we give them the tablet with some ID, they have to match. If they enter the data into the wrong ID, then it will become a very huge problem. So that will go with the for the sites.
So anyway, we have kept this information basically to help the field worker. And basically, we are not going to share this data to other. Even if we have to share the data to BIREC and other, we de-identify the data and then we share the data to the BIREC also. So so that thing is there. So which it will be not used for the analysis purpose or to share the data. It's a closed system and it is not.
Shared under the agreement.
Yeah.
So I don't know how ethics committee will take that, but it's
So it's up to you how you can manage. If you want, you can keep. Otherwise,
We'll discuss internally and get back to you.
sure. Yeah, exactly. So. So I think so we can start working on the fever reporting part. So we can on the tablets. So please.
I think
So I
some guys are
request
already started.
like everyone to just keep the track of all the issues and everything documented. And if anyone from the site who are working on the remotely, if they share their feedback to the site itself who are present here, and we will take them as a consideration. Okay.
दूसरा अगर आप सेम डे का कर सकते हो आप फीवर रिपोर्ट तो 11 को फीवर हुआ 11 ही आप रिपोर्ट कर सकते हो बहुत कोई काम हो गया
10 पीस है
करो बैक करो नहीं ये तो अभी तक आया नहीं ना अरे आगे तक जाओ हाँ अगर आज ही बुखार बताया उसने और आप जा रहे हो तो क्या मतलब आप नेक्स्ट डे सुबह जाके रजिस्ट्रेशन करेंगे फीवर रजिस्ट्रेशन
हाँ
7
हैं
आज जैसे मान लो मैंने फोन करा ठीक है आज ही वो उसका फीवर चलना स्टार्ट हो गया रजिस्ट्रेशन तो मुझे करना है ना हम ये
This conference will now be recorded.
डॉक्टर नीरज डेट ऑफ ऑनसेट ऑफ फीवर
इसके डॉक्टर
ऑनसेट ऑफ फीवर एंड डेट ऑफ फीवर रजिस्ट्रेशन सेम नहीं हो सकती नहीं हो सकती बट नहीं ले रहे बिकॉज इसमें लिया है
11 अप्रैल डाला मैंने
तो वो कर दीजिए मैं ठीक कर दूंगा
वो लिख रहा हूं मैं।
लिख दीजिए तो सेम डे पे भी रिपोर्टिंग हो सकती है और उसके पहले नहीं और दो जरा उल्टा लगा दिया
नेक्स्ट वाला जो क्वेश्चन है वो भी मतलब कितने दिन हो चुके हैं
हाँ डेज ऑफ नहीं वो भरना है वो उनको रिसर्च ऑफिसर कैलकुलेट करने दो बट ऑटोमेटिकली पॉसिबल है ना कि हमारा कि कितने दिन का डिफरेंस है क्योंकि हम डेज वाइज ले रहे हैं घंटों के हिसाब से चल देखिए बेसिकली देखिए जो डे ऑफ ऑनसेट टोटल डेज जो है ना वो कैलकुलेट करने की जरूरत भी नहीं है आप इसकी जब डेटा आपके पास अवेलेबल है ऑटोमेटिक वो कैलकुलेट करोगे यहाँ कोई सेंस नहीं बनता है इसको 2 दिन
तो कल से उसको बुखार है आज भी बुखार है
2 दिन हो गए। अब ये चीज देखिए, मैं पहले आज वाइज चल रही थी, ठीक है, अब डेज वाइज हो गई है, 2 दिन के बाद ही हम उसको कंसीडर करेंगे, ठीक है। तो अब आप डेज ही मिलिए, पहले उसको शाम को आया ऑफिसर, ठीक, अब तो फिर वैसे हो गया।
बारह के बाद
अगर मतलब उसको 1.5 दिन, मतलब हमारे तरफ से 1.5 दिन है, तो मेरे 2 दिन हो गया एप्लीकेशन है कि नहीं। तो ये चीजें वैसे आवर्स बेस था, तो फिर ये था कि अगर उसको 12 बजे आया है, 11 बजे आया, तो फिर 12 बजे की वर्ष और 11 बजे ही होगा।
मतलब हम कल फीवर था, उसको 1 दिन करेंगे, 2 दिन करेंगे।
तो आज 1 दिन कंप्लीट हो रहा है, आप कल करोगे जाके।
ठीक, वो तो क्या कल ही करेंगे।
का कोई प्रॉब्लम नहीं, और विदाउट इन्फॉर्मेशन रहे तो मुश्किल है, तो क्या ऐसा आइडेंटिफाई करता, लाइक ग्राउंड लेवल वर्कर्स को भी उसको फॉलो अप करके इन्फॉर्मेशन दे, तो नहीं तो सीएचएस इन्फॉर्मेशन देते हैं, कौन इन्फॉर्मेशन देंगे पार्टिसिपेंट्स को गॉट क्योर फॉलो को तो
अब देख रहे हैं यूआईडी आई है, ये FEMDID आया, अरे ये अच्छा ठीक है। 225124214 ये तो हमारी हुई इंडिविजुअल आईडी। यूआईडी यूआईडी आपकी फीवर आईडी है। यूआईडी में कैसे गड़बड़ करता है यूआईडी का, मतलब यूआईडी हर जगह सिस्टम में इन्होंने गड़बड़ नहीं कर दी है कि हर जगह का यूआईडी अलग अलग लिखा है, हर जगह यूआईडी का मतलब अलग है।
नॉर्मल रेगुलर इन्वॉल्वमेंट किया जाए पीआईडी अलग है।
हाँ वो एग्री है, बट
दिक्कत हो जाएगी सर।
कल को बुखार है तो आज तो कल से बुखार से पहले 2 दिन हुए, कल 10 बजे हुआ, 11 बजे आज देखो ना, ये तुम्हारी सब्जेक्ट आईडी इधर एपिसोड में कुछ यहाँ पर आया था, क्या FE1 आया आपने 1 भरा है? हाँ बहुत सारे कैलेंडर डेज फॉलो करो, कैलेंडर डेज दैट वाज सजेस्टेड बाय डॉक्टर नारायण ड्यूरिंग द दैट when put it as a calendar rather than putting it as बताओ कि इसमें फीवर वाले में आप यूआईडी को कंसेप्ट कर रहे हो या थर्ड वाले में क्लियर नहीं हो रहा पार्टी
रजिस्ट्रेशन जो आपने किया फीवर का रजिस्ट्रेशन किया, हां ठीक है, मतलब फीवर का रजिस्ट्रेशन करोगे तो यूआईडी क्या होती है? फीवर वाले का रजिस्ट्रेशन यूआईडी कौन सी
आप अपना सारे सब
यूआईडी
वो यूआईडी उसका पार्टिसिपेंट नहीं होगा, अब यहाँ पे पार्टिसिपेंट आईडी कहीं है नहीं, जबकि वो हमारे हिसाब से ये वाली पार्टिसिपेंट आईडी है।
तो अब यहाँ पे
अभी यूजर आईडी क्या ना, ये वेरिएबल का नाम है।
सब्जेक्ट आईडी करके या पार्टिसिपेंट आईडी करके
ये क्या है हमारा, ये पूरा स्टैंडर्ड है। आईडी आपका क्लास में जो है ना, ये कंपोनेंट है जो ऑप्टिमाइजेशन में भी ऐसी है,
तो आपका सब जगह यूआईडी आएगा। कंफ्यूजन है, फील्ड वर्क के लिए कंफ्यूजन है।
यूआईडी के नीचे वाली FIND है यही ना यूनिक है।
हाँ वो फीवर की हो गई, डेथ करने का डेथ की हो गई, और
ये वाली जैसा कि ये UID जिसके अंदर 1471 है, ये फीवर आईडी
जो होगी ना वो
नीचे वाली अलग
जो फॉर्म के अंदर में वो डालोगे, ठीक है। अब क्या है, फीवर आपने रजिस्टर किया, फीवर की रजिस्ट्रेशन आईडी ये है, ठीक है। अब ये मेंशन करोगे जिससे कि हम कनेक्ट कर सकते।
तो सभी जगहों में ना यूआईडी को ही
देखिए यूजली क्या होगा ना,
वो बना देते हैं।
मैनुअल मिलेगा ना तो उसमें वो डिटेल में रहेगा, तो आप उसको देखिए समझ सारी मैसेज करके कल के समय एक बार कॉल पे जाएंगे जब एक पूरा मैनुअल पार्ट बचा
पार्टिसिपेंट आईडी को कहीं पे एक जगह में कुछ करना पड़ेगा हमारे को हाईलाइट कि ये पार्टिसिपेंट आईडी फीवर IND वो फीवर की है।
हॉस्पिटल में SID हो गया, मतलब एक जो
तो आपको सिंपल अगर टीम है जो वो डेथ रजिस्ट्रेशन कर रही है तो बोलना पड़ेगा कि आप इसको यूआईडी जो है ये आपकी यूआईडी, ठीक है। अगर मैं यूआईडी अगर मैं इसमें लिख देता ना तो वो क्या करते हैं कि पार्टिसिपेंट की यूआईडी इस पे डाल देते हैं, वो डेथ में भी डाल देते हैं, तो ये प्रॉब्लम हो जाती है, ठीक है। ये आपको ट्रेनिंग में देना पड़ेगा, उसको ट्रेन करना पड़ेगा।
750 वो पार्टिसिपेंट आईडी चेक करना पड़ेगा उसको। अच्छा ये ठीक आया,
मतलब क्या चेक करना,
तो पार्टिसिपेंट आईडी उससे सही भरी है
ये वाली। हाँ ये तो उनको जब वो फिल कर रहे हैं तो उसको सेलेक्ट करना ही है, उसमें नाम के सब कुछ आती है, तो ड्रॉप डाउन में जाएगा वो तो
प्रैक्टिकली जब करेंगे फील्ड में तब वो
एक तो जिसमें मतलब कंपनी में वो तो जो तो क्या बिल्कुल लेवल को देगा आप जब तक,
बट हमें ध्यान देना
तभी रेट ऑफ कांस्टेंट है
डेट ऑफ कांस्टेंट ये आउटसाइड डेट है।
यहाँ पे पर्सन स्क्रीन रखते हैं तो ये पूरा फैल जाता है, तो अगर आपको ये देखना है डिटेल में तो आप यहाँ पे देख सकते हैं,
समझ,
ठीक है। जैसे आपने देखा था यूजर आईडी ये है, ठीक है, नेम ये है, डेट ऑफ कांस्टेंट ये है, तो आप उसको मत इसको भी कर सकते हैं, वो शॉर्टकट
ठीक है। वही यूआईडी आपके मतलब यूआईडी नंबर के आगे में यूआईडी टर्म वही यूआईडी आपका रजिस्ट्रेशन पर्सन रजिस्ट्रेशन में भी आएगा, फीवर रजिस्ट्रेशन में भी आएगा, हॉस्पिटल रजिस्ट्रेशन में भी आएगा, डेथ रजिस्ट्रेशन में भी आएगा, ठीक है। 4 यूआईडी आएगा। मोटी यूआईडी जो है एक शब्द 3 टर्म मतलब 3 वर्ड्स, हर जगह मतलब अलग है। सर्टिफिकेट रजिस्ट्रेशन में उसका पार्टिसिपेंट की आईडी है, फीवर रजिस्ट्रेशन में वो फीवर रजिस्ट्रेशन आईडी है, डेथ के उसका यूआईडी का यही मतलब, ठीक है। और जो यूआईडी हमारी पर्सनल इंडिविजुअल आईडी है, मतलब यूनिक पर्सन की आईडी है, पांचों जगह में अलग अलग टर्म यूज कर रहे हैं।
और क्या उसको कोई प्रीफिक्स या सफिक्स का है?
मतलब जैसे आपको देखना
तो वहाँ पे आईडी तो सेम रहता है।
तो इसमें नीरज जी, इसमें क्या जो आईडीज है, इसमें क्या ये जो कोड है, ये साइट स्पेसिफिक है या रैंडम नंबर है?
नहीं, साइड स्पेसिफिक मीनिंग है। इसमें आप देखोगे ना, कुछ चीजें कॉमन है, जैसे 2 to 5 है, ठीक है। ये यहाँ पे जैसे अभी ये सब्जेक्ट आईडी, ये सब्जेक्ट का सीक्वेंस चल रहा है, ये दूसरा सब्जेक्ट है, मतलब जैसे ये आपका ये लास्ट 2 नंबर रखोगे, इससे भी काम चल जाएगा। ये नंबर ये, जैसे ये कॉम्बिनेशन है,
एलिमेंट्स है।
हाँ,
100 digits denotes है।
तो यूजली लाइक लास्ट 2 digit लाइक दिस नंबर, दिस नंबर कैन बी यूनिक फॉर यू। अगर आप देखना चाहते हैं, जैसे क्लस्टर नंबर हो गया, ठीक है, और मेरे ख्याल से यूजर आईडी है, ये क्लस्टर आईडी मुझे एक बार देखना पड़ेगा, ये कॉम्बिनेशन है, उसके बेस पे चलता है। 1 2 3 4 5 6 7 8 9 10 11 12 13 मतलब अगर पूरा होगा, लेकिन ये चीज होगी ना, अगर पूरा क्लस्टर जाएगा ना, ये कॉमन होगा।
2 to 5 1 to 4 to कॉमन रहेगा।
जब आप इसको पेपर में ट्रांसफर करने जाते हैं, आपने सोचा नहीं
एक महीने में फॉर्म बना के अभी आप इसको भी पढ़ के मैंने फीवर से, तो फीवर से मतलब यूआईडी हो जाता है, ठीक है। तो ये सब एक ही मतलब स्टडी सब ठीक है, तो हम कोई स्पेसिफिक नहीं बना सकते, मतलब इसको भी अकॉर्डिंग टू प्रोजेक्ट को कस्टमाइज करिए, उसके लिए वीडियो के लिए अलग से एफर्ट करना पड़ता है। तो डेडिकेटेड सॉफ्टवेयर बनाना पड़ता है।
स्टेकहोल्डर आईडी आगे
वो डेटा क्या होगा
means the terminology of FUID. अगर आईडी फॉर्म में रजिस्टर कर लेके मैंने उसको अलग उससे लिंक भी किया, हमने सर्च करके वो पार्टिसिपेंट की भी आईडी लिंक की है फीवर। हाँ, फीवर अप्रूव फीवर का रजिस्ट्रेशन किया है ना, तो उसकी आईडी जनरेट होगा
अलग से, और वो
हाँ फीवर आईडी, और उसका जो लिंकेज होगा वो इंडिविजुअल पार्टिसिपेंट आईडी से होगा। वो डेटा में आएगा, जब डेटा डाउनलोड करोगे ना उसमें रिफ्रेश होगा। जो डेटा है ना, जो फॉर्म भर रहे हो ना, इसमें ये तो भर रहे हैं ना,
और वो
सब में वैसी प्रोसेस है, चाहे बैक है, तो जैसे अभी मैं जो ये जो यूआईडी है, ये इंडिविजुअल पार्टिसिपेंट आईडी है, ठीक है। और ये अगर आप देखोगे, ये फीवर की आईडी है, ये देखिए आईडी का डिफरेंस है। ये 514671 ठीक है। अब ये मैंने क्या किया है, इस पर्सन का मैंने लिंकेज कर दिया। मैं डेटा नहीं करूंगा तो मैं इस डिपार्टमेंट के कितने फीवर एपिसोड और इसको मैनी करेगा सकता है, और इसको वन करेगा तो मैनी करेगा सकता है कि एक पास में मल्टीपल प्रोफाइल फीवर ठीक है। अब इस आईडी से मैं और मतलब आइडेंटिफाई करूंगा इससे कितने फीवर के मैं लिंक कर हाँ हाँ। अरे वो क्या है कि पूरा वो लिस्ट दिखाता है, ठीक है। जैसे कुछ डिपेंड करता है स्टडी टू स्टडी, बट आपको कंप्लीट वाला यूज कर लेना, कंप्लीट ही वाला यूज करोगे या पेंडिंग वाला यूज करोगे, ठीक है। लेकिन कोई स्टडी में क्या होता है कि बाद में वो इलिजिबल हो गया, ठीक है। लेकिन हमें बाकी चीज
Yeah. So for the online participants, we just want to request that the meeting for today is closed. Only the sites which are present here, they are just doing some EDC work, practice. So that is ongoing, but online participants can log out. Yeah. Thank you. The information regarding the tomorrow's meeting will be shared. Thank you.
ठीक है। आप इसको लिंक कर लीजिए, क्या कहते हैं जो इंडिविजुअल वाला है ना, फीवर वाला आ रहा है।
हम अभी फीवर है मतलब, बट वो आएंगे ही ना, क्योंकि मल्टीपल एपिसोड होंगे साल भर में।
वो सर्च कर लो, लेकिन आप क्या करिए जो बेसलाइन वाला जो आ रहा है ना वही सिलेक्ट करिएगा जिसमें